Good morning and welcome guest of honor, chief guest, speakers and delegates in our fourth webinar organized by Indira Gandhi School and College of Nursing. Once again, good morning one and all. I am Shalini, nursing tutor in Indira Gandhi School and College of Nursing, Amethi. It's my proud and privilege to address on behalf of Indira Gandhi School and College of Nursing, which is organized webinar on infection control in clinical setting, quality control on 10th June 2021. You can watch this on YouTube channel rgcsk.edu live. Really, this topic is needed in this crisis situation and hope so it will be effective for the audience.
Good morning, one and all. I am Miss Afreen, nursing tutor, Indira Gandhi School, College of Nursing, Amethi. So I would like to introduce our college, which is located at Amethi, Uttar Pradesh, India. Indira Gandhi School and College of Nursing started in the year of 2007 with the motto of Seva Parmo Dharma. It's one of the unit of Indira Gandhi Group of Institution in the memory of former our Prime Minister of India, Srimati Indira Gandhi ji, under Sanjay Gandhi Memorial Trust. Indira Gandhi School College of Nursing is affiliated to Indian Nursing Council and approved by UP State Medical Faculty, recognized by Ram Manohar Lohia University and Atal Bihari Vajpayee University. Indira Gandhi School and College of Nursing presently offers courses of General Nursing and Midwifery, Auxiliary Nursing and Midwife, Basic BSc Nursing, Post-Basic BSc Nursing, Certificate in Baby Nursing and Child Care. Thank you.
Hi everyone. I am D. Ilakona Bhaskar Raj, Principal, Indira Gandhi School and College of Nursing. Welcome you all. This is our fourth webinar, the webinar series under IGSCON, Indira Gandhi School and College of Nursing. Honorable Administrator Sir, respected Director Madam, dear Chief Guest, my eminent speakers, various college faculties, and my dear delegates. It is my proud privilege to welcome our Honorable Administrator Sir, Sanjay Gandhi Memorial Trust, Wing Commander retired Manoj Muttu Sir. Sir is backbone in guiding and supporting all the activities of college and this webinar. Thank you, sir, and welcome for this function, sir. Next, it is my pleasure to welcome our Director Ma'am. Ma'am Srimati Sharimala Roy Chaudhary Ma'am, Director of Indira Gandhi Group of Institution, Amethi. Madam has enlightened her minds to organize such webinars, online classes, and student welfare programs continuously. Thank you, ma'am, and welcome, ma'am, for our program. It is great honor for me and introduce my today welcome my chief guest, Dr. Dinesh Selvams, sir, Principal, Columbia College of Nursing, Bengaluru. Sir is well-known personality in nursing profession, is a great leader and great teacher even. Because I have the sir, I am the student of sir, my senior, I am mentor. Welcome you, sir. I welcome all eminent speakers and guests from all the different parts of country, different walks of life. You have shared to your knowledge to our students, and all the eminent speakers have the experience with the student community. Welcoming all delegate speakers. Last not least, I welcome all dear delegates, for our knowledgeable webinar series. Welcome all once again. You can enjoy our webinars because it is a current situation. Infection control is vital role for all the infectious disease. All are think about COVID, but even though as a nurses knows communicable disease is main quality or main tool of controlling is infection control procedures. So I hope this webinar topics will give the more knowledge on the topic of COVID also, as well as all the infectious disease topic also. So thank you once again giving this wonderful opportunity. Thank you one and all.
Now, I would like to give special address to our Director Ma'am of IGGI, Indira Gandhi Group of Institution, Srimati Sharmila Roy Chaudhary Ma'am. Madam is very loving and energetic and always guiding in our development of nursing education in our institution, and having always interest in reaching the knowledge to students in this crisis through the YouTube channel rgcsk.edu, and always motivating us to do online teaching and webinar. I am heartily welcome you, ma'am. Please give a keynote on today's webinar. Please, ma'am.
Good morning, everybody.
Good morning.
Now that I'd like to welcome everybody, and I'm very pleased that this is the 4th webinar that we are conducting. It's quite amazing how we've been able to progress from online classes which were sent on WhatsApp chats to having Zoom classes to having webinars. And this is a reflection of how our Indira Gandhi School and College of Nursing principal, our tutors, and everybody else associated with it are able to make an opportunity out of a situation. The COVID-19 situation hit us pretty badly. We were all wondering how to deal with it, and you all have come up with this wonderful way of dealing with the whole situation, of imparting knowledge to our students, and you're getting better and better at it. However, at this juncture, I must also mention the team at RGCSK, who are the backbone and who are giving us all kinds of technical support to be able to achieve this. Now, coming back to today's topic, infection control in clinical setting, a quality role. Well, whether it is a COVID situation or a non-COVID situation, infection control is a necessary part of a nurse's professional environment. And I think, Bhaskar, if I'm not mistaken, we've had a seminar on this topic earlier, right? Nima, we've had a seminar on this topic earlier, infection control. And you're on mute, doesn't matter. So if I'm right, just raise your hand. And I'd of course like to welcome all our eminent speakers, our delegates, and all our participants. And I notice that our registration is increasing day by day, and so are our participants. Very, very happy to carry on with this series, and hopefully we'll get better and better at it. With this, I will request you all to continue. Our administrator is a little busy at the moment, but he will join in at some point during the webinar. Thank you.
Thank you, ma'am, for your motivational and encouraging words. Thank you, ma'am.
Good morning, one and all. Respected Administrator Sir, Director Ma'am, eminent speakers, Principal, and all the delegates of this webinar. Good morning, one and all. I am Mrs. Nima VP, Professor in Indira Gandhi School and College of Nursing. It's my honor and proud privilege to heartily introduce our Chief Guest of Nursing on this today webinar, Dr. Dinesh Selvams Sir, on behalf of our esteemed institution, Indira Gandhi School and College of Nursing, on this infection control in clinical setting a quality role. Sir have more than 21 years of experience in the field of nursing, especially in education, administration, clinical and research field. Sir have a professional qualification. Sir completed BSc Nursing in the year 1997 from Shree Balaji College of Nursing, Tamil Nadu under Dr. MGR Medical University. Sir achieved Master in Science on Community Health Nursing in the year 2002 from Hemamalini College of Nursing under Dr. MGR Medical University. Sir perceived Philosophy of Nursing doctorate degree on 2015 from Hemamalini College of Nursing from Dr. MGR Medical University, Tamil Nadu. And other certificate of proficiency in the principle of Unani system of medicine from Naimat Science Academy. Sir have certificate in basic counseling skill from Velamar Institution, certificate in writing for research and publication from Nursing Studies in the International Summer School, the University of Edinburgh, UK, e-learning course on ICH, Good Clinical Practice in the Global Health Network. Sir had a short course on diabetic and CVD in the International Diabetic Federation, School of Diabetic. Recently, Sir had e-certificate on Let's Break the Chain of COVID-19 Infection from the Mohammed bin Rashid University of Medicine and Health Sciences. And professional experience, Sir have the experience of clinical instructor, assistant lecturer from Shree Balaji College of Nursing from the year 1998 to 2005. Sir have an experience of assistant professor in Padma College of Nursing, Bengaluru in the year 2005 to 2007. Sir was in the position of principal and professor, HOD of Community Health Nursing Department from the year 2007 to 2015 in Padma Institute of Nursing. Sir was professor and HOD in Shraddha University, Noida in the year 2015. Sir was professor and HOD in the year 2016 at School of Nursing Science, Dayananda Sagar University, Bengaluru. Sir was Dean of Studies in Medical and Paramedical Science in 2016 to 2020 in Dr. Mohan Diabetic Education Academy, Chennai. Now, Sir was in the position of Principal in Columbia College of Nursing, Bengaluru. Sir was a resource person and presented more than 30 presentations in various national, international conferences, workshops and seminars. Sir published more than 11 titles in various national and international journals. And Sir was a life member in Trained Nursing Association of India. And Sir, member of Society for Nursing Practice, and Sir was a member of International Academic Nursing Science. Sir has awards such as Arunachalam prestigious Trust Silver Medal Award for the Best Clinical Nurse in MSc Nursing at Hemamalini College of Nursing 2002, Best Poster Presentation in the International Conference on Qualitative Research Methods organized by International Center of Collaborative Research in PHC in Hemamalini College of Nursing, Best Research Paper Presentation in International Conference on Epidemiological Research in Advanced Nursing Practice organized by PIMS, Puducherry. Sir has a prestigious award of Best Teacher, Best Institution Award for World Record Essay title Conserve Natural Resource for Future Generation from Karnataka Pollution Control Board, Lifetime Achievement for receiving Doctorate of Philosophy in Nursing, Medal of Annual Cultural Meet from Dr. Mohan, Diabetic Group of Institution. Sir has various activities like paper evaluator, examiner for community health nursing under Dr. MGR Medical University, coordinator cultural health nursing under Rajiv Gandhi University of Health Science, Karnataka, verification officer of PG paper in Rajiv Gandhi University of Health Science, and task force inspection committee member in Rajiv Gandhi Health University of Karnataka, and member board of studies in Rajiv Gandhi University of Health Science and Shraddha University. Sir is a very knowledgeable, energetic person. I am very happy to welcome our chief guest. Sir is my teacher and my role model. I am here because of you, sir. Sir is a very good knowledge in the field of administration skills. I take this opportunity to welcome you, sir, in this section on infection control on quality tool. Thank you, sir. Carry on with the section, sir.
Good morning, everyone, and thank you, Nima, for that elaborate presentation of my CV. It was so nice of you, and I think after a long time, I'm seeing Nima and Lakona Bhaskar. So happy to see you in this platform and in this institution doing good. We know that you people are very able, and do wherever you go, you people will do wonder, no doubt on that. And coming to this webinar, I submit my humble greetings to the administrator and the director ma'am and the principal and the faculty and everyone in Indira Gandhi School of Nursing and College of Nursing. It's so nice to see you all in this platform, a group of nursing people conducting a web series. It's not so easy, we can say very easily as webinar series, but there are a lot of work and a lot of work to be done at back to make these webinars very successful. So it's also very much evident, you know, how the administrators and the directors and the management team with the faculty team and with the students, they are doing this good work in the institution. The all credit goes to all your hard work, what you people are doing. I really appreciate and submit my humble greetings to everyone. Yeah, 1 minute. Yeah, now this topic on infection. 1 minute. So this topic on infection control is an apt topic which you have selected for this webinar during this pandemic era. But as director already told, let it be pandemic or non-pandemic, infection control is the basic responsibility of a nurse in the hospital that everyone knows. But this infection control or the infections that is acquired in the hospitalization are very alarming. Sometimes this is not brought out to the evidence or to the picture most of the time. So you all know we have around 10 patients who are getting this hospital acquired infection. So we say it as hospital acquired infection, or in our time they say it as healthcare associated infections. They say it as healthcare associated infections, HAI. So this, it contributes about 7 to 10%, 7 to 10% of the admissions that is made in the acute care hospital. So this is not only going to increase the burden of the disease, and it becomes a very high question mark to the safety of the patient when we are giving the nursing care to the patients in the hospital. So the topic selected for this webinar has a highly mark on the present situation, and it is based on the importance of the role of nursing in preventing and controlling the infections that is acquired in the hospital and keeping the quality of the patient care at always in the hospital, isn't it? So that's why this topic is seemed to be very important at this present situation. But when we are talking about hospital acquired infection or infections where we are having eminent speakers for this today's webinar, whom they are going to highlight about all the hospital acquired infections. But Bhaskar has given a twist in this topic. So he has given that to use infection control as a quality tool. Yes, it is essential. What the management says and the principal says is right, because hospital acquired infections are alarming, as I already told you. The quality, how we are going to deliver the quality care to the patient. So the quality care to the patient, when is delivered the quality care to the patient, when we are looking about the safety, when we are looking about the patient satisfaction, and when we are looking about the quality of the patient care, this hospital acquired infections should have a check. So that's what about I mean this today's webinar, where they are going to talk about infection control, the practices, and how we can achieve the quality in the clinical setting when providing the safe infection control precautions and everyone. So to just go about, just highlight about this particular topic, I just want Lucknow Bhaskar to share slides. Yes. Yes, the first slide.
Yes, sir. Sharing the slides, sir.
Yeah. So I think all are able to see the slides. So we say infection prevention and control is a definition given by WHO. All the students and the participants who are attending the webinar can go through this World Health Organization definition. So they give very clearly it is a practical, evidence-based approach where preventing the patients and health workers from being harmed by avoidable infections. So they are very clear. So the evidence-based, what are the research-based evidences that is provided? With that evidences, we are going to prevent this kind of infections which can be avoidable. So this is mainly to bring about the patient safety and to also protect the health workers. And the effective infection control requires the constant action of all the levels of the health system, mainly the policy maker and facility managers, health workers, and whoever is there in the healthcare services. That's why the quality tool comes, how you are going to maintain the quality. So considering the prevention of infection in the hospital is ultimately going to give you the quality tool. Okay, so infection prevention and control, it is going to affect in all the healthcare, but to name, to mention very particularly, you have hand hygiene and you have surgical site infections. The major infections which is happening is surgical site infection, which accounts more of the hospital acquired infection. And injection safety, and another thing which is cropping up is this antimicrobial resistance. Patients fighting with many diseases and many antibiotics working on them, and at one stage they have antimicrobial resistance, and how hospitals operate during this emergency. So that's what all about infection control. The next slide. Yeah, so this is considered as a discipline where it aims to control and spread any kind of infection in the healthcare facilities, not only in the hospitals and also in the community. So when we talk about quality, you would have heard the various terms for the quality. So we say quality care, quality patient care, quality improvement, or total quality management. These are the names which are related when different strategies are being maintained in the hospital. So mainly these, you would have heard about quality assurance, infection control quality assurance, so infection control quality management. So these are the best possible outcomes that you can give it to the individual patient. Yeah, next slide. So this is going to your basics. Everyone know how the infection spreads, and this particular diagram will show you the chain of infection, where it starts from any source or any reservoir, that may be the patient, water or food or any inanimate fomites we say, which is present in that particular environment. So it enters, it goes through the portal of entry, you say, into the patient. It may be a mucous membrane, respiratory system, digestive system, or broken skin, and then it affects through the mode of transmission we say. So the mode of transmission may be physical contact or droplets or airborne, when you touch or patients, or when you touch an inanimate objects which is being soiled, and it enters into the susceptible host to the portal of entry, what we have told. So it leaves there, it multiplies, it spreads its infection, and it finishes its course of infection and come to the convalescent period and get exit from the particular host, and it goes to the new individual or the new host, isn't it? So this is what happens in the chain of infection. Very basics for students who are listening to just recap about this. Next slide. Right now, coming straight away to the point, what World Health Organization recommend in order to provide or implement an infection prevention and control in the healthcare facilities. So WHO has given you 8 components, we can say 8 core points, which talks about how to maintain a quality of patient care, or how you can prevent this infections. One is national IPC programs are there already. So under this program, they come out with the definite objectives and definite good practices that is associated with the healthcare infections, and also to address the antimicrobial resistance. So this is one component what WHO prescribes us. And second, it gives about the guidelines. So there are evidence-based guidelines coming out from the WHO. You can refer it from the manual, all the healthcare organizations, that gives the IPC guidelines that has to be developed from for their own institution and implement that into good practice. And the third one is the education and training, which the guidelines and the protocols by the WHO is going to be given as a training or education to all the health workers who are involved in the particular healthcare setting, isn't it? Then you have surveillance. Surveillance is continuous monitoring. So when you formulate a team, a continuous monitoring of what is happening in the hospital acquired infection is required. Next slide. Yeah, you have multi-level improvement strategies. So this multi-level improvement strategies can be employed at even the district level. There is you can coordinate at the national level or the district level or the state level in order to the facilitations what you have made for a good practice to prevent this infection control in the hospitals and in the other setup. Monitoring, evaluation, and feedback is the next component, which is very essential. See, continuous monitoring by the hospital infection control team is going to play a major role in order to cut down the infections in the healthcare acquired infections. So in that, the team will set up the performance indicators and will find out what are the measures or what are the practices it's being done on the form of activity in the particular healthcare setting, isn't it? Then your workload, staffing, and bed occupancy, seeing about that the hospital bed is not overcrowded or overloaded based upon the faculty. All these minor things also should be noted down in order to control the infection. So build environment, material, and equipment where you can give a clean and hygiene environment to the whole patients who come for the treatment in the hospital, isn't it? So these are the 8 components what World Health Organization recommends in order to have a good practice in preventing the infections in the hospital. So what are the key indicators if you have an infection? Next slide. So what are the key indicators we have mentioned? How you can measure whether an infection control program is going on well in the hospital. So one, we say it as a compliance. It all comes under the quality assurance model. So if we measure, or the nurses can come out this infection control practice in the hospital as a quality tool when they are monitoring certain key indicators. So we group them under compliance indicator, process, and outcome. So you all will be knowing about the systems theory, where you tell about input and process and outcome. This is somewhat correlating with the where compliance indicator, where you will identify what are the measures being practiced, what is their input in the particular organization. So whether they have adequate guidelines is there, adequate policy is there, and adequate material and resources are there in order to implement the infection control practices in the hospital. For example, how many of them do the hand wash, whether there is a hand wash provision, and whether it is accessible to all the health workers who are involved, and whether you have provided with all the facility or the resources that is required for the healthcare workers like PPEs, etc. This all comes under the compliance indicators which you are identifying. Then you can measure or monitor the quality through something called process indicator. This process indicator is the implementation process. So this involves whether all the workers who are trained in infection control practices and all the nurses or all the healthcare workers who are involved in the hospital are trained with adequate policy, infection control policies, and how it has to be implemented. It starts from training, and you monitor exactly what they practice, how they are going to practice, what is the percentage of the people are really involved in the strict adherence to the safety practices, isn't it? This all comes in the implementation. We call it as process indicators. The other indicators are the outcome indicator. Outcome indicator, you know, when monthly you can take out how many surgical site infections are there. So how many of them have suffered from other nosocomial infection, any pneumonia, any urinary tract infection in the catheterized patient, whether it is increasing or not, isn't it? Or any other related infections, any antibody resistant infections are developed. These indicators are the outcome indicators, which is going to give you the effect or the result of the practice or the implementation what has been put in that particular hospital, isn't it? So these indicators, infection control committee or any healthcare institution will follow in order to achieve quality in practicing the safety practices in the hospital. Next slide. So you take a hospital or a healthcare institution, so you want to achieve quality, and that quality you aim at infection control and safety practices. So what will be the components? One will be preventive measures, one is surveillance, and another one is training. So these three are the going to be the component in any healthcare institution when you want to implement this infection control practices in the clinical setting as a quality tool, isn't it? Next. Yeah, so you take preventive measures. All the healthcare organizations should be knowing about the standard precautions and the isolation precautions and procedures, whether it is taken down, whether it is practiced, and the immunization of healthcare workers, and other sterilization, disinfection, and decontamination of the instruments used in the healthcare setting. Bundle care approach. See, bundle care approach for certain procedures is necessary. Infection control cannot be achieved only by nurses. So you see, there will be an infection control committee where even a microbiologist, a doctor, a pathologist, and a medical lab technician, and nurses, isn't it? All will be involved. So all will be involved. All has to work as a team. This is called as bundle care approach. One, as a team, and second, you focus on certain infections which is very much appearing in that particular hospital. You take urinary catheter infections. You have more urinary infections for the patients who are under catheterization in the hospital. Then you will prepare a bundle care for that particular infection. So this has to be put in the practice or the protocol. And then you all know about personal protective equipment, whether everyone is using in order to prevent. Yeah, so these are the preventive measures which you have to practice. Next. It still follows with antimicrobial program. See, and use of single-use device. And antimicrobial program, mainly by the lab technology people, they have to go and check whether any, whenever when the patient is getting discharged from the particular room, they should go and do the required testing, whether any microorganisms are there, like, right? Then use of single-use device, spill management, what can be done, and reporting and managing of accidental injuries by sharps, and blood and use of blood and blood products is happening in the healthcare hospital. What is the policy or the protocol? And hospital bio-waste management and environment management practices. This all comes under the preventive measure if you want to achieve quality. Next. Yeah, this is surveillance. Usually surveillance, you should understand that it is a continuous monitoring. So how you monitor them passively, how you will monitor them actively. So passively, you have a control infection control team which is going to report. These reports are taken right? These reports are taken every time. The reports will be laboratory based and medical records based, and reports which is given by the physician and the nurses. Nurses should be very prompt in reporting any needle stick injuries, and nurses should be very prompt in reporting any other hospital acquired infection that is happening with the patient, isn't it? And catheter care, everything, all these reports should be collected. That is passive surveillance. They collect, the infection control team in a hospital collect these reports passively from the records, from the medical record, post discharge, how many of them, what is the length of the stay of the patient, isn't it? When the infections are getting controlled, the length of stay will be reduced ultimately, isn't it? And laboratory, they do laboratory test of identifying. So these things can be done passively. So actively, you can very well see what are the prevalence, any ventilator associated pneumonia, surgical site infection, isn't it? So all the other nosocomial, any other nosocomial infection, all will be the evidence to see actively, and you can monitor all these things. And you can have a safety infection control practice by wheel has been shown there, isn't it? You can collect the data through surveillance, how I have told, active data and passive data, then you put it into analysis, then you give the feedback, then you target from where the action should be taken, whether based on the report or based on the finding, who has to be targeted, isn't it? And then this, again, you evaluate whether the infection has come down or what, again, what is the action. So this is a wheel like which happens with the monitoring when you are having an infection control team in your hospital. Next. So next is the training, very essential. See, the training should include, sometimes when the nurses or any other health worker are entering into the hospital at the beginning stage, the component of this infection control should be stressed. Patient safety should be stressed. That's what they say about this training. Of course, all are given training, but what component of infection control practices and safety practices are added to them is the question mark. So they have to be sensitized about infection control program for all the healthcare workers, and there should be a periodic in-house training, isn't it? And there should be an hospital or infection control team, and where all, including the doctors, nurses, and the other team, they have to be updating each and everything, and they can represent, they can go and attend the national level infection control committee. They have to implement their protocols, isn't it? And of course, organizing a regular workshop or symposium like how you do now is going to provide them with adequate knowledge of infection control practices, isn't it? Next. So this is about the essential things which to talk when we are talking about the quality measuring or quality assuring in the case of infection control in the clinical care settings. Of course, the speakers are going to talk in detail about all the hospital acquired infections, isn't it? They are going to talk in detail about all those things, how it can be prevented. So I strongly recommend that an infection control committee, when looking after the proper preventive measures, monitoring and training are going to be the key fact when you are going to give a quality. And there are a lot of quality tools, quality assessment tools are there in the hospital when you want to measure the outcome of the practices what you are putting it in the hospital. So these points I wanted to highlight when it is talked about infection control in clinical setting as a quality tool. And at this outset, I again say or submit my thanks and greetings to everyone. That's it. Hope I have given the content in a very brief manner for this today's webinar.
Thank you, sir. Your session was very informative. Sir has given a word on infection control, quality management, total quality management. Sir has discussed about the chain of infection and outbreak of infection, and what are the multi-level improvements such as strategies, continuous monitoring, workplace, staffing, bed occupancy, and sir has insisted about WHO given 8 core points such as guidelines, evidence-based guidelines and education and training. And sir has speak about the key indicators, mainly the input, process and output, complaint indicators, process indicators and outcome indicators. Sir has given the components of hospital infection control programs, discussed about the preventive measures such as standard precaution, immunization, bundle care approach mainly, and personal protective equipments provision for all the staffs, and antimicrobial program. Sir has clearly given the information of surveillance, that is the report of infection control, and discussed about the infection control program cycle very effectively. And sir has lastly discussed about the training of healthcare workers, and this was very effective and informative. Thank you, sir, for your valuable informations and guidelines regarding infection control equality tool. Thank you, sir. This might be a very informative section for our delegates.
Thank you,
For,
Ma. Thank you.
sir. Thank you, sir.
Thank you.
Hello everyone. Good morning to all. Hope you all are safe and fine. Myself, Afreen, nursing tutor, Indira Gandhi School, College of Nursing, Amethi. I am very happy to introduce sir for today's webinar. Mr. Santhosh SU, Principal, 1 Beat College of Medical Sciences, Veera, Lakhimpur Kheri, Uttar Pradesh. Sir is our second speaker of today's webinar, and he will deal with the topic concept of infection and hospital acquired infection. Sir did his BSc Nursing from Sri Kanaka College of Nursing, Tumkur, Karnataka in the year of 2004, and also owns master degree in pediatric nursing in the year of 2009 from Rajiv Gandhi University of Health Sciences, Bengaluru. Sir completed MBA in Hospital Management from Integral University in the year of 2021. Sir did doctorate PhD Nursing from Sri Venkateswara University, Amroha, UP. Sir currently working as a principal in 1 Beat College of Medical Sciences, Lakhimpur Kheri, Uttar Pradesh. He had about 10 years of teaching experience, UG and postgraduate nursing program. Sir had so many accomplishments in our nursing field. Sir also received certification in pediatric ALS courses. Sir also member of professional bodies in Nursing Scholars Society. Sir also being the resource person in national conferences, workshops and webinars. Sir had participated and presented various research papers in various conferences, and his publications are included in national journals. Sir is very energetic and passionate for our nursing field. I heartily welcome you, sir, to take your session and share your knowing to all of us. Sir, please. Thank you.
Thank you, madam, for giving a brief introduction about me. And my warm greetings to the guest of honor, Manoj Mattu sir, administrator, and chief guest, Srimati Sharmila Roy Chaudhary, director, Indira Gandhi Group of Institution. And a special thanks to Bhaskar sir for giving me this opportunity. And it's my pleasure to be a part of this webinar. And I would also like to thank Dinesh Selvams sir for giving he has touched all the points of this webinar. Okay, now I will, without wasting much time, I'm going to share my presentation. Okay, good morning to one and all present over here for this webinar series organized by Indira Gandhi School and College of Nursing, Amethi, Uttar Pradesh. Sir, can you able to see my screen now?
Your screen is showing.
Yeah, okay.
Yes,
Thank you.
sir. Please go ahead.
Just a second. Okay. Before starting the session, let's start with the beautiful quote by Florence Nightingale. This the very first requirement in a hospital is that it should do the sick no harm. That means that we should not harm the sick, those who are admitting to the hospital for the betterment of their health. Let's start this history of infection. The infectious diseases were responsible for the largest global burden of premature death and disability until the end of the 20th century, when that disinfection passed to non-communicable diseases. Over these previous centuries, global pandemics of infectious diseases such as smallpox, cholera, influenza, these all periodically threatened the survival of entire population. And in 1980, smallpox, which is responsible for around 300 to 500 million deaths. And in the 20th century, it was declared to be the first disease eradicated from the planet, following a global immunization campaign led by the WHO. As we all know that most of the infectious diseases can be treated by giving proper immunization at proper time. And the emerging pandemic viral infections remain a constant threat, as many of the infections entering the human population from contact with animals. As we all know that the recent coronavirus, which has been infected to human beings from the animals. And the most recent such infections include the SARS, severe acute respiratory syndrome, Middle East respiratory syndrome, Ebola, Zika virus, as well as this perennially influenza and chikungunya infections are also affecting the humans. And this COVID-19 infection has affected more than 2.9 crore people in India with more than 3.5 lakh deaths. Also, 174 million population affected worldwide and about 3.7 million deaths occurred. This is the current situation what we are facing due to this infection. And let's move on to the historical perspective. The concept of this disease transmission and contagion was well established before microorganisms were identified. Before the identification of microorganisms itself, the disease transmission and how these diseases are going to affect the human beings were being identified. And the existence of these microscopic organisms was discovered during the year of 1965 to 1983 by the two fellow research persons, Robert Hooke and Anthony van Leeuwenhoek. And this John Shaw was one of the first to apply this epidemiological methodology to infectious disease with his classic investigations of the Broad Street cholera epidemic in the year 1854. Till then, these microorganisms were not been identified. And in the year of 1860, John Lister proved the importance of aseptic technique and disinfection in reducing the incidence of infections following surgery. And then Ignaz Semmelweis, he was born in 1818 and died in 1865. He was an Hungarian doctor who discovered the bacteria, disease, and infection. And he's also known as the father of infection control. And Semmelweis observed that if the doctor washed their hands, the number of infections of puerperal fever could be reduced. For this reason, Semmelweis ordered his medical students to wash their hands before and after the medical rounds. But most of the people, most of the fellow doctors during this period, they didn't agree with him and they mocked him, but he couldn't prove his findings because bacteria had not been discovered during this time. And in the year of 1870, Robert Koch proved that bacteria can cause diseases. And also this Louis Pasteur also proved that the germ theory of disease only after Simon Well's death. Okay, when he was alive, he was telling the people that infection will spread, so we have to maintain this hand hygiene. But no one believed that. But after his death, many people proved that his theory was right. And nowadays, we are all following this hand hygiene technique to prevent the spread of infection. And I'm going to explain some facts about the infection. That is, according to the Centers for Disease Control and Prevention, CDC, this infectious and parasitic diseases account for about 15.5 million doctors visit every year and 3.7 million emergency room visits each year. And many of these infections are preventable through vaccination. The WHO estimates that vaccination can prevent 2 to 3 million deaths each year. We can save more than 2 to 3 million deaths each year by just giving the vaccination at the right time. And antimicrobial resistance continue to be a public health threat. Like some organisms of concern include this drug-resistant strains of gonorrhea, staphylococcus bacteria, and candida yeast. And new causes of infection are always emerging. And some of the examples you may be familiar with. This includes severe acute respiratory syndrome, Zika virus, Ebola virus, and coronavirus. Now, what is an infection? The infection is the invasion and multiplication of microorganisms in the body tissues, which may be unapparent or the result of the local cellular injury caused by the competitive metabolism, toxins, intracellular replications, or antigen antibody responses. And an infection can cause no symptoms. When someone is infected, they can show symptoms and they cannot show symptoms. Okay, in few people the symptoms will be more, and in some people, there are some patients, the symptoms will not be visible. And an infection may remain localized, or it may spread throughout the body or lymphatic vessels to become systemic. Some infections can be local infections and some can be systemic infections. And microorganisms that live naturally in the body are not considered infectious. As we all know, there are millions, billions of microorganisms living in our body, and which is not causing any infection to our body. For example, the bacteria that normally live within the mouth and intestine are not infectious. As we all know that all microorganisms are not infectious to human beings. Some microorganisms are very helpful to maintain our body. And there are some types of infection which can occur, like the primary infection, reinfection, secondary infection, focal infection, cross infection, nosocomial infection, introgenic infections, endogenous infections, or exogenous infection, and latent infection. What do you mean by a primary infection? The primary infection is the exposure of a pathogen for the first time, and the reinfection is when we are exposing to the same pathogen for the second time, or second, third, or fourth time. We can consider that as a reinfection. And secondary infection, it is the infection which is infected by the pathogen or immunity lowered and can cause invasion by other pathogens too. And local infection is a localized infection and cross infection. A cross infection is the transfer of harmful microorganisms, usually this bacteria or virus. The spread of infection can occur between peoples or a piece of equipment or within the body. And nosocomial infection, it's also known as hospital-acquired infections that we are going to deal in the next slides. And introgenic infections, these are the drug-induced infection during the course of treatment. When you are taking any treatment, if the drug is inducing any other infections, then it will be known as introgenic infections. And endogenous infections is when a commensal enter places, it should not be when there is the external particles or external foreign bodies entering our body. It is also when it causes infection, it's called known as endogenous infection. And exogenous infection, that is when a pathogen comes from the other sources. And latent infection, that is the parasites remain in tissues in latent or in hidden forms, proliferating and producing clinical diseases when the host resistance is lowered. Next, we'll move to the hospital-acquired infection. This hospital-acquired infection is also called as nosocomial infection or healthcare-associated infections. And nosus means disease and comio means to take care of. And the nosocomial infection can be defined as infection acquired by the person in the hospital, mainly manifested of which may occur during hospitalization or after discharge from hospital. The person may be a patient or a member of hospital staff, or he may be a visitor. Okay, these nosocomial infections can easily spread from one person to one person when a patient is having any other infection. And when he is admitted to the hospital, his immunity will be little lower compared to others. And as we all know that healthcare workers or this doctors, nurses, and other members, they will be working in the hospital and they are more exposed to the nosocomial infections and they can get affected. And we are seeing this, many people are going to admit in the hospital, and to see the patient, many people will visit that, their relatives, friends, everyone will visit the hospital. So they are also having the chances of getting this hospital-acquired infection. And the magnitude of the problem is the hospital-acquired infection occurs worldwide and affects both developed and resource-poor countries. It's not like that this hospital-acquired infection will affect only this developing countries or developed countries. It will affect each and everyone if we are not following the infection control protocols properly. And nearly over 1.4 million people worldwide will suffer from such infections. Next, we'll see this most common sites of nosocomial infections. Like the most common, as per the source of CDC, the most common sites of nosocomial infections include this urinary tract infections, surgical site infections, and lower respiratory tract infections, and bacteremia transmitted primarily by this IV infusions or IV catheters, and cutaneous infections, and others. The commonest forms of hospital-acquired infections are due to the invasive procedures carried out on the patients. Why these hospital-acquired infections are common, or why it will occur? It's because of the surgical operations. Because when the surgical operation is done, there will be open, this portal of entry will be there. So by that, the infections can easily invade and it can affect the individual. And intravenous therapy, IV intubation, if you're not following this hand washing or hand hygiene techniques, then through intravenous therapy also, the infection can spread easily. And the intubation, catheterization, and in the immunodeficiency of varying degree is seen in many of the patients admitted to the hospitals, and especially the patients at the extremes of their age, especially the children or the elder peoples. They are at more risk of acquiring hospital-acquired infections. And the patients with diabetes mellitus and the persons who are receiving immunosuppressive drugs, or the patients with cancer, in particularly those undergoing this chemotherapy. And these patients are more prone to infections with bacteria which have little threat for healthy person. As we all know that this infection, this hospital-acquired infection is more common in the persons with suppressed immunity. And there are so many other people working in the hospital, they will not get affected with this hospital-acquired infection, maybe because of their immunity. And next we will look on the epidemiological triad. In epidemiological triad, we can see this, that there are three agents. That is, one is the agent and host and environment. The agent or the microorganisms that can cause a disease such as bacteria, virus, parasites, fungus, and these are all called as these agents which can affect the peoples. And it's also called as the what of the triangle. And next, the host or the organisms harboring the disease, and it's also known as who of the triangle. That is the what, who, and where. That is where is environment. Those external factors that causes or allow disease transmission, where the disease is going to occur because of the host and environmental factors. The host is going to affect with the infection. Next, the chain of infection. Selvams sir has already explained this chain of infection. In this chain of infection, we can see the agents, that is the microorganisms or germs like bacteria, virus, parasites. Those are going to affect the individuals. And where germs are living, it's also known as the reservoir, like the peoples, animals, pets, dogs, cats, wild animals, food, soil, water. But especially in hospital acquired infection, what will be the reservoir? Like the patient is staying in his ward or the hospital ward or the surgical bed or the surgical instruments, whatever the in hospital we are using, or even the clothes, beds, everything will serve as a reservoir in hospital. And how germs get out of the body. When a person is infected, how these germs are going to get out from his body. That is the portal of exit, through mouth while talking, or through vomit, or through saliva, and from the cuts in the skin, blood, when doing any surgical procedures or any other procedures, like when inserting this IV line. This infection can come out of the body. Or during diapering or toileting, when the person is going for toilet. In a hospital, you can't find separate toilets or separate bathrooms for each and every person. Most of the peoples will be using the same toilets. That is the main source of spreading the infection. And also germs get around. How these germs are going to transfer from one person to another person. Like it's also known as the mode of transmission. It may be through contact by hands or toys or sand. Nowadays, we are following this no touch policy, like instead of handshaking, we can use this. We can, as we are all following this Indian culture, like namaste, by without touching the hands. And through this droplet infection, when you're going to speak, or when you're sneezing, or when you're coughing, the infectious organisms are going to come out of the body, and it will going to transfer to other persons. And how these germs get in? How these germs are going to enter our body? Through mouth, or through cuts in the skin, through eyes, from all the portal of entry, that is all the openings of the body, these germs are going to get in. And next is a sick person, that is a susceptible host. The host may be at the extremes of age, as I told earlier, this babies, children, or elderly peoples. They are the main peoples, those who will get affected easily with this hospital acquired infection, or the people with a weakened immune system, and unimmunized people, or anyone else in the surrounding, in the environment. The next, all the microorganisms can cause nosocomial infection. Either it can be a bacteria, virus, or fungus, or parasites, or prion. All this can cause nosocomial infections. And what are the sources of infection in the hospital? From where this infection is going to spread in the hospital? Like the other patient, if someone is suffering from other disease conditions, and when a new patient comes in and they are sharing the beds, or they are nearby, when we are not maintaining the distance between each bed, then they are going to get easily affected with hospital acquired infections. And the visitors, those who are coming to visit the hospitalized persons, or even hospital persons during the care of the patients, or while doing any surgical procedures, and in the air, water, food, and patient's normal flora, fomite, contaminations, and devices which are going to use for the treatment of the patients, and drains and catheter. And exogenous sources of infection or this other patients, like cross infection can occur and through the healthcare workers, and inanimate objects or fomites, which are also known as vehicle for transport of this bacteria, and inanimate environment of the hospital. It is contaminated air, contaminated water, and contaminated food, and the equipments and instruments which are used for other persons. And these equipments and instruments, before using to any other person, it should be cleaned and sterilized properly. Unless sterilized, it should not be used for other persons. And solid linens, as a patient, this bed gets soiled, it should be replaced. And the hospital waste, the biomedical waste management should be properly managed. And endogenous sources, the endogenous sources is the normal intestinal flora or the colonizers of the skin and other epithelial surfaces. As we all know that intestinal microflora has around 1014 microorganisms of around 500 species. And what are the main mode of transmission of hospital acquired infection? It's mainly through the contact, like, or it's also known as handborne diseases, and aerial route or airborne, and oral route, parenteral route, and vector-borne. These are the mode of transmissions. Like contact, it is the most common method. It's the most common ways through which the infection is going to spread. It may be through direct contact or through indirect contact. Direct contact is also known as the physical contact through the hands, cloths, or any droplet contact, and through clinical equipments, those who are used for the care of the patients. And indirect or through contaminated articles like bedpans, bowls, jugs, instruments, or needles. As we all know, nowadays we are all using this disposable needles. And previously, the needles were not, this syringes, needles, they were not disposable. For many patients, they are going to use the same, but with proper sterilization. If they are not following the sterilization techniques, then the infection is going to spread. Then the dressings and the contaminated gloves, etc. These are all the indirect way through which the infection can spread. And next is the airborne transmission. The droplet, respiratory secretions on surfaces, or inhalation of infectious particles. When we are talking, or when we are sneezing, when we are coughing, or when we are doing any exercises, and there are so many chances through which this airborne transmission can occur. And next is the oral route. It's also known as this fecal-oral transmission of infection. And next is the parenteral route through non-sterile tattooing needles and contaminated dialysis equipments and contaminated vaccination, or for using these equipments, and non-sterile dental practices, contaminated drug needles, or non-sterile body pursing equipments, or any other surgical procedures what we are all going to conduct in the hospital. These are all the routes through which this parenteral this infection can transfer. And vector-borne through the parasites, like when we are using this uncovered foods, unpacked foods we are eating, then it can easily transfer the infection from one person to another person. And there are universal or standard precautions for infection control. How these infections can be controlled through by following these 10 points. It's easy to stop the spread of infection like the hand hygiene by using this personal protective equipments and safe handling and disposable of shops, and follow the needle stick injury protocols and safe handling and disposable of wastes like biomedical waste management and managing blood and body fluids, disinfection of equipments, environmental disinfection, immunization, and isolation of patients in case of necessary. Hand hygiene. How this hand hygiene can stop the spread of the infection. The hand hygiene are the most important vehicle of transmission of hospital-acquired infection, and there are so many ways through which this hand hygiene techniques can be followed, especially the hand washing techniques. There are like medical hand washing or surgical hand washing, or even routine hand washing will also stop the spread of infection. Or we can use this alcohol rub sanitizers. And next, this 5 moments for hand hygiene. When we have to do this hand hygiene, that is before touching the patient, or before clean or aseptic procedures, and after body fluid exposure risk, and after touching a patient, or after touching patient's surroundings. At least after all these 5 points, if we are following this hand washing technique or hand hygiene technique, most of the spread of this hospital acquired infection can be reduced. And personal protective equipments. This personal protective equipments must be used whenever we are treating the high risk patients, like use of gloves, disposable plastic aprons, masks, and eye protections. And next is the safe handling of the sharps. That is sharps, before using or before discarding the sharp instrument, we should ensure that the sharps are not passed from hand to hand. When you're using this sharp instruments, it should not be passed from one hand to another hand, and needles are not broken or bent before use. For sterilization technique, or when we are not having the proper hygiene, these needles, some people are going to burn the needles before the use, but it should not be practiced. And sharps are disposed of at the point of use. When you are going to use these sharp instruments, and after single use, it should be discarded. It should not be used for any other persons, or for the same person, it should not be repeated. And sharp containers are not filled more than 2/3, and staffs are aware of inoculation injury policy. And when you are discarding the sharps, do not throw these loose sharps in a trash, and do not put sharps in recycle bins, and do not flush sharps down the toilets, and it should be kept out of the reach of children. And follow the needle stick injury protocols, like irrigate a mucous membrane by washing under running the water, and do not suck or squeeze the injury site. This is the main mistake what we are going to do, that we are going to suck or squeeze the injury site. And wash with soap and water, apply antiseptic lotion to the injury site, and contact emergency room medical officer for management, and complete the incident report and inform to the infection control nurse. And safe handling and disposal of waste. That's biomedical waste management. Later on, you're going to see in details. That is how to segregate the waste at source and know the policies and protocols of the state, and safe disposal and safe handling of spillages. And managing body and blood and body fluids. While handling the specimens, the safe collection, labeling, and transfer methods to be followed. If you're not collecting the samples properly, or not the labeling is not correct, or while transferring, if you're making any mistakes, then it can cause injury, or it can, the collected specimen will be wasted. Or dealing with the spillages or small spills and spotted spills or large spills, how to handle this, how to manage the small spills. Like we should wear gloves and eye protectors when we are treating any patients, and contamination should be wiped up with paper towels soaked in freshly prepared hypochlorite solutions. And if broken glasses are present, first treat the spillage with hypochlorite, then carefully remove the glass piece with disposable forceps and wipe it out. As we all know, this blood and body fluids can easily transfer the infection from one person to another. And the towels and glasses should be disposed of in a yellow clinical waste bag for incineration. And we should wash our hands properly. And how to manage the large spills? We should mark that area as a large spill and wear a PPE, liquid spill solution, and left for 2 minutes. And use absorbents to absorb and wipe that with water and detergent. Allow that area to dry and put all the towels, gloves to yellow bin for incineration. How we are going to disinfect the equipments? It should be categorized like non-critical or semi-critical or critical sterilization. The main methods to be followed for disinfection of equipments are cleaning, disinfection, and sterilization of contaminated object significantly reduces and often eliminates microorganisms. The method of cleaning, it is removal of all soils from objects and surfaces. And aseptic techniques or asepsis, it is the absence of pathogenic microorganisms, and it's of 2 types, that is medical and surgical asepsis. This aseptic techniques should be followed. And the disinfection, it is the process of killing microorganisms. Spores are not involved in disinfection, and through sterilization we can kill all the microorganisms and the spores. And how to disinfect the environment? Establish the policy and procedures to prevent food and water contamination, and establishment of a regular schedule of hospital cleaning with appropriate disinfectants, for example, wards, operating theater, and laundry services. As we know that when there's a death of a patient, that entire ward or the bed, it should be completely disinfected and the area should be fumigated. Before that, it should not be given to any other patients. As we are seeing the picture, the whole ward will be covered with this most of the microorganisms, where it can easily transfer the infection from one person to another. And the dispose of medical waste safely. Needles, syringes should be incinerated, and other infected wastes can be incinerated or autoclaved for landfill disposal. Bag and isolate solid linens from normal hospital traffics. And immunization. As we all know that most of the infections can be reduced by proper immunization, and especially the medical staffs working in hospital should be immunized for this hepatitis A, B, and influenza, measles, mumps, rubella, tetanus, diphtheria. And immunization can be given against varicella, may be considered in specific cases. And as per the current situation, we all know this status of this COVID vaccination. Around 23 crores people has been vaccinated with this corona vaccine virus. As we are seeing that there is a decline of infection spread in the peoples, those who are vaccinated. And the next point is the main important point to stop the spread of infection is isolation. Whenever there's a chance of spreading an infection, isolated from other patients. And whenever possible, avoid crowding in the wards. We should avoid the crowding, like we have to maintain this visitor hours. So these visitors cannot sit in the hospital wards with the patients for a long time, and we should not allow the visitors to stay with the patients. By that we can stop the spread of infection, and implement specific policies and procedures for patients with communicable diseases. All these communicable diseases patients or non-communicable disease patients should not be kept in a same room, and private rooms and wards for patients with specific disease conditions, visitation policies, hand washing and use of gloves, gowns, and when appropriate, use of proper mask, eye protections, gowns, and precautions should be taken with sharp instruments and needle. If you are using this sharp instruments or any other articles for a communicable disease patient, it should be discarded or it should be disposed properly. It should not be used for any other patients. Now, how to break the chain of infection? How can we break this chain of infection? How can we stop the spread of this infection? Like proper immunization and treatment of the underlying diseases, health insurances to support for financial support to the healthcare workers, and patient education for wearing the mask or using the hand sanitizer, and for hand washing and all we can teach to the patients so that they will also protect themselves by getting this hospital acquired infection. And breaking the chain of infectious agent. How can we break the chain of this infectious agent? By proper diagnosis and treatment at the right time, and antimicrobial stewardship, like antibiotic therapy should be started to break the chain. And the reservoir, the dirty surfaces or equipments, to break the chain, we should properly follow the cleaning and disinfection methods, and proper infection prevention policy should be there, and pest control should be properly done, because we all know this vector-borne diseases, they can easily spread from the pests. So this pest control should be there in the hospital. And the portal of exits. For breaking the chain of this portal of exit, we can maintain this by using the proper hand washing techniques, by using personal protective equipments, and control of aerosol and splatters, and respiratory equities, and waste disposal, proper waste disposal. And the mode of transmission, the chain of this mode of transmission can be break by proper hand washing and personal use of personal protective equipments, food safety, cleaning, disinfection, sterilization, and isolation. And the portal of entry, the break of chain can be done by following the proper hand washing techniques and personal protective equipments and personal hygiene, first aid, and removal of catheters and tubes by this aseptic techniques. And next is prevention and control of infection, hospital-acquired infection. That is observance of aseptic technique and frequent hand washing, especially between the patient. When we are treating 2 to 3 patients, we should wash our hands, especially even after treating each and every patients. And careful handling, cleaning, and disinfection of fomites, and whenever possible, use of single-use disposable items. Nowadays, in most of the hospital, they are following this single-use disposable items to prevent the spread of infection. And the isolation of patient, especially the communicable, if they're having the communicable diseases, they should be isolated. And avoidance wherever possible of medical procedures that can lead with high probability to nosocomial infection, especially this urinary catheter. In most of the places, as we are observing that these catheters will be inserted in the ward itself. So there are many chances are there for getting the infection. So these procedures should be done in a separate area where the aseptic techniques can be followed. And various institutional methods such as air filtration within the hospital, through which we can control the spread of infections, and appropriate isolation precautions to protect the patients, visitors, and healthcare workers. And surveillance for common infections, monitoring of high-risk patients, and hospital area to identify the outbreak, document incidents, and prevalence rate of specific infections, and which should set goal for improvement. So you know that the infection control team can do all these works, and the spread of infection can be stopped. And next, the 5 pillars of infection control. These 5 points are considered as the 5 pillars for controlling the infections. That is isolation of patients and barrier precautions, and decontamination of items and equipments, and prudent use of antibiotics, proper hand washing, and the decontamination of the environment. And next is the infection control checklist. How can we check whether the infection control is happening or not? That is, have you washed your hands? We should ask ourselves, and the hospital authorities should check all these checklists to prevent the infection. And do you need to use personal protective equipments before treating any patient? We should aware that have we washed our hands, and do we need to use the personal protective equipments? As nowadays we are saying this, to treat the COVID patients without personal protective equipments, no one is going to treat them, because everyone is aware that it will spread the infection to other persons. And are you preventing the sharp injuries? And are you disposing of waste safely? And do you deal promptly with spillages? And do you thoroughly decontaminate the equipments before use and after using? And are you maintaining a clean environment, whether the hospital environment is clean, whether inside or outside the hospital? And do you know what to do in the event of an accident, in case of emergency or a fire accident or any other event happening inside the hospital? So what should be done? It should be all the healthcare workers working in hospital should know all these things. And do you know your workplace procedures, whether the workplace procedure is well known or not? The infection control team has to explain all these things to the newcomers. Here we comes to the end of the session. The conclusion of the session is, the infection is a constant enemy of mankind. The emerging pandemic, viral infections remain a constant threat, as many infections entering the human population from contact with the animals. And the concept of disease transmission and contagion was well established before microorganisms were identified, and many infections are preventable through vaccination. The World Health Organization estimates that vaccination can prevent 2 to 3 million deaths every year. And hospital-acquired infection worldwide can affect both developed and resource-poor countries. And around 1.4 million people worldwide suffer from such infections. And infection control is a big challenge to the medical world, as there are various strategies to prevent and control the spread of infection in hospital, like cleaning, disinfection, sterilization of contaminated objects, significantly reduce and often eliminate the microorganisms. So all the healthcare professionals should follow these key steps to prevent and control the hospital-acquired infection. So we should take at least 10 to 15 seconds to wash our hands and save the patient's life before giving care. And any questions?
Thank you so much, sir, for so informative session. The session was packed with lot of information into a short time duration about nosocomial infection. You had also explained about how to break the chain of infection and what are all the causes of infection and mode of transmission. In sources, there is 2 sources you also explained, exogenous and endogenous sources. And the very important things, the standard precaution for infection control, and also well explained about personal protective equipment and infection control checklist. Not only the students, but all of us had a good session on concept of infection. Thank you, sir.
Thank you.
Hello everyone, good morning to all. I am very happy to introduce sir for today's webinar. Mr. Venkatasan sir, Professor, Padma Shree Institute of Nursing, Hassan. Sir is our third speaker of today's webinar and he will deal with the topic of standard precautions in health setting. Sir did his BSc Nursing from Padmavati College of Nursing, Dharmapuri under the Tamil Nadu. Dr. MGR Medical University in the year of 2006 and also owns master degree in medical surgical nursing in the year of 2009 from Sri Ramchandra College of Nursing, Chennai. Sir completed PG Deep Diabetic Education from International Diabetic Federation in the year of 2012 and also completed MSc Psychology from University of Madras in the year of 2012. Sir did doctorate PhD in nursing from Sri Ramachandra Institute of Higher Education and Research in the year of 2020. Sir currently working as a professor in Padma Shree Institute of Nursing, Hassan. He had about 13 years of teaching experience, UG and PG nursing programs. Sir had participated and presented various scientific research papers in various conferences and his publications are included in national and international journals. He is actively participating in the field of medical surgical nursing. He bagged and published 8 books to his credit, such as Management of Nursing Services and Education, Solved Question Paper, Nursing Foundation, the Textbook of Medical Surgical Nursing, and Cardiothoracic Nursing. So, I would like to invite Mr. B. Venkatasan, sir. Please come and take your session. Thank you, sir.
Thank you for your brief introduction. So I thank organizers of Indira Gandhi School and College of Nursing, Director ma'am and Administrator sir and Principal sir, Bhaskar sir, and all the faculty members who has given me opportunity to as a speaker of today's sessions. So today I'm going to speak the topic on hand washing, isolation, transmission-based precautions on PPE. So these are the key elements which I'm going to discuss. So first I'll deal with the hand washing. So hand washing is the most simple method which can be used in the hospital and healthcare setting where to prevent the infections. So introduction about the hand washing. So practicing hand washing is a simple and effective way to prevent the spread of infections. Failure to perform appropriate hand washing or hand hygiene is considered to be leading cause of nosocomial infection and spread of the multi-resistant microorganism. So in the hospital setting, the hand washing is a very essential. If failure to perform hand washing, which results in the patient may developing as a hospital-acquired infection as well as multi-drug resistant infection after admitted in the hospitals. So which has shows a significant contribution to the infection outbreak in the hospitals. So hand hygiene is therefore the most important universal precaution to avoid the transmission of harmful germs and prevent the healthcare associated infections. So hand washing is a main, simple and first key element which can be used in the hospital setting to prevent the infection. So terms related to the hand washing, hand hygiene, performing hand washing, antiseptic or hand wash, alcohol, hand rub, surgical hand hygiene, antisepsis. Hand washing, washing hands with plain and soap water, antiseptic hand wash, washing hands with water and soap or other detergent containing an antiseptic agents. Alcohol based hand rub, rubbing hands with an alcohol containing preparation. Surgical hand hygiene, hand washing or using an alcohol based hand rub before operation by using surgical person. So these are the certain key terms which related to the topic. So why wash your hands? Why the healthcare professional or other people they need to wash their hands? So hand washing is a single and most effective way to prevent the spread of communicable disease. Mainly in the communicable disease which is happening in the worldwide, if the person they want to prevent the infection communicable disease spreading one person to another person, they have to do for the proper hand washing. So purpose of hand washing, the first purpose, remove all dirt and debris. So when we do the hand washing, we try to eliminate whatever the dirt particles and debris which is present in the hands, the healthcare professional as caregivers. Second purpose, reduce cross-contamination from microbes. So cross-contamination means when the nurse is going to handle the patient, one patient, again she is going to give the care for other patients. So she can able to transmit if she is not performing properly hand washing. So hand wash which will reduce the cross-contamination of microorganism. Third purpose, it interrupt fecal-oral route infection. Mainly certain infections which can be transmitted through orophycal route like hepatitis A, E, or certain diseases like typhoid. So which can be prevented when we perform proper hand washing procedure. Reduce risk of hands acting as a vector. So certain diseases can be transmitted by through the hands, as like hands will be acting as a vector. So when the person they wants properly hands, the disease can be prevented. Break a chain of infection. As like earlier speaker, he told the mode of transmission, certain diseases can be transmitted by the hands. So when you do the proper hand washing, the chain of infectious chain can be broken. So infection will not spread to the other persons. Increase the image of the cleanliness of healthcare professionals. So when the healthcare professional, they do the proper hand washing, which will prevent their hands become as a clean absence of organisms. So which may show that their image will be improved. So these are the certain purpose of hand washing and transmission. So hand transmission, how the hands which is transmitting for the infections. So hands are most common vehicle to transmit healthcare associated pathogens, mostly microorganism or hospital acute infection, which can be transmitted through the healthcare professional hands. So transmission of healthcare associated pathogens from the one patient to another via healthcare professional, which can be prevented if you do proper hand washing. So certain key sequence of steps can be followed hand washing to prevent the infection. The 5 steps are, as like earlier speaker also is shown the picture, before touching the patient. So we are going to handle the patient before touch. We need to do the hand washing procedure before clean. So before we are going to give any bath or any procedure, any aseptic procedure, we need to do the hand washing procedure. And after body fluids exposure, because certain body fluid exposure which may cause the infection like blood, through the blood product which can transmit for the hepatitis B or C infections. After touching the patient, so after you touch or you give the care also patient, you need to do the hand washing. And after touching the patient's surroundings, because the patient's surroundings also which contain certain germs and microorganisms. So as healthcare professional, we need to do the hand washing after touching the patient's surrounding. Why should you clean your hands as healthcare professional or caregivers? So any healthcare workers, caregivers or person who involved in the patient care need to be concerned about your hand hygiene, because therefore hand hygiene concern you, because it can be transmit the infection from healthcare professional to the patient or patient to the healthcare professional. So therefore the hand hygiene concern you, you must perform hand hygiene too. Why we need to perform? To protect the patient against germs, harmful germs carried on the hands or present in the hands or over the skin. Protect yourself and healthcare environment from harmful germs. So 10 most common ways of spreading the disease are 10 fingers. As we discussed, the hand hygiene is important because as healthcare professional, our 10 fingers which involve spreading of the disease from the patient to the another patient or from patient to the as healthcare personnel we used to get. So hand hygiene is a single and most effective way to prevent the infection. So types of hand washing, as like in the medical field, we have the hand washing, medical hand washing, and surgical hand washing. So types of hand washing, medical hand washing. The main medical purpose of washing the hands to clean the hands hands of pathogens like bacteria or viruses and chemicals which can cause any harm or disease. So we do the hand washing in the medical setting to prevent the diseases or to clean the pathogens. To effectively to reduce the growth of germs on the hands, hand washing must last 40 to 60 seconds and it should be performed following steps. So hand washing should be performed whenever is necessary, as well as it should be performed at least minimum 40 to 60 seconds. Those steps of hand washing we'll discuss next one. So surgical hand washing, the purpose of surgical hand scrub is to remove debris and transient microorganism from nails, hands, forearms, and to reduce the resident microbial count to minimum and inhibit the rebound of the growth of microorganisms. So when you perform the surgical hand washing, mainly to reduce the growth of the microorganism and to stop the growth of the microorganism and transmission of the microorganism. So steps followed for the hand washing. There are the 11 steps followed for the hand washing. The first, when we are going to use for the water and soap, wet the hands with plain water. Step 1, apply enough soap to cover all the hand surface. So entire hand surface should be covered with the soap water. Rub hands form to form. So second step, form to form rub should be done. Step 3, right palm over the left dorsum with interlock fingers and vice versa. So third step, right palm over the left dorsum with interlock fingers and vice versa we have to do for the left side to the right side. Step 4, palm to palm with the finger interlock. So palm to palm finger interlock should be done. Step 5, back of the finger to opposing palm with fingers interlock. So the back of the fingers to opposing the palms with finger interlock should be done. Step 5. Step 6, rotate a rubbing of left thumb clasped into the right palm and vice versa. So once we finish the right side of the fingers, then we can go for the left side. Then the 7th step, rotational rubbing of the backwards and forward with the clasped finger of the right hand in the left palm and vice versa. So it should be done the right side as well as for the left side. Once finished the rubbing of the backward and the forward, then we have to rinse the hands with the plain water. Once after completing the rinsing the water, dry the hands properly and with a single towel, and we have to close the tap by using for the towel. The last step, hands should be dried completely. So these are the 11 steps can be used for the hand washing when you use for the water with soap. So how to do the hand rub by using for the hand rubs. So how to do the hand rub effectively to reducing the growth of the germs in the hands, and hand rubbing performed following the steps based on the picture. It can be performed 20 to 30 seconds. The steps completely we have to apply the hand rub the entire surface of the hands. Step 1. Steps 2, rub the hands palm to palm. Step 3, right palm over the left dorsum with interlocked fingers and vice versa. It should be done right side followed by the left side of the hands. The 4th step, palm to palm finger with interlock. So palm to the palm interlock should be done. Interlock. Step 5, back of the finger to opposing palm with the finger interlock. So back of the finger opposing palms with fingers interlock. Step 6, rotational rubbing of the left thumb clasped with the right palm. So rotational rubbing of the left thumb clasped with the right palm, as well as again the right thumb should be rubbed with the left clamp should be done. 7th step, rotational rubbing backwards and forward with the clasped finger of the right hand in the left palm. It should be done vice versa for the left side. So once we are to dry the hand. So when used for the hand rub, there are the 8 steps should be followed based on the WHO guidelines. So benefit of alcohol hand rubs. Why we need to use for the alcohol-based hand rubs? It require less time. When you use for the hand washing, it need for the more time. For example, we need with the water, soap, and the sink. Where the hand rub, it less time consuming. Immediately they can use it for the hand rub again. They can able to wash it with less time consuming. So it can be completed within 20 to 40 seconds, whereas hand washing can be performed for the 40 to 60 seconds. It can be strategically placed. It can be placed as a strategy, whichever place is the patient is there, again, any area of the hospital is readily accessible. So the hand rub will be readily available without the need of water. It can be used any places and multiple sites. It can be placed multiple sites, whereas the patient with the sink and water, it can be placed only wherever the water supply is available. All the patient care areas also, even the now hospital setting, we can see all the patient area, one hand rub will be placed to do for the hand rubs. So again, it acts as a faster. So when you do the hand rub, it will destroy for the microorganism faster and excellent bacterial activity. So it's going to act in the bacteria excellently, then less irritating. So what happened here, the less irritating. So less irritations will be there and sustained improvement. So when you do this hand rubbing, sustained improvement in the infection control measures. So time constraint and major obstacle for hand washing. What are the obstacles we do face for the hand washing? There should be adequate hand washing time with soap and water record, because sometimes the staff, they have the shortage of the time or there is no availability of the water and soap. So it should be done 40 to 60 seconds. Average time usually adopted by the healthcare professional more than 10 seconds. Or alcohol-based hand rub should be available. It should be 20 to 30 seconds. So these are the key. It is a main time constraint. Again, other factors. So remember to wash hands. It should be minimum 20 seconds as healthcare professional whenever we handle the patients. So nurse's responsibility in hand washing procedure, perform hand wash periodically based on the need. For example, whenever as like I told, the 5 sequence, whenever essential, as a nurse, we need to perform the hand washing procedure in order to prevent the infection as well as to preventing the transmission of the infection. Educate the patient caregiver if necessary. For example, when the patient, those who are communicable disease patient, they're going to give the caregivers. So caregiver also necessary should be taught about how to do the hand washing to prevent the infection. Observe the other healthcare professional whether they are following for the based on the hospital policies as per hand washing is performed. Again, nurse will be involving in the infection control team to framing for the guidelines about hand washing procedures. So this is all the nurse's responsibility about hand washing procedure. So next topic we are going to discuss on isolation and transmission based precautions. So isolation, the separation of the patient's person with infectious disease from contact with other human being for a period of communicability. Mainly the isolation which can be done the patient with a communicable disease in order to prevent the disease transmission from one person to another person. It can be the infectious person can be isolated separately. So what are the need for isolation or need of isolation? So isolation aimed controlling and preventing the spread of infections. Mainly, as like I told, mainly the communicable disease which can be controlled and which can be prevented when you do for the proper isolation of the patient. So it is mainly the spread of infection can be controlled. Even now the epidemic situation also, mainly the COVID patients are isolated or they are quarantined. So isolation precautions are designed. Isolation can be done into the rooms where in the hospital rooms, or it can be isolation wards to minimize the transmission of infection in the hospital by using updated skilled technology. So by using the appropriate technology, the patient can be isolated depending on the hospital policies. Isolation helps to protect the patients, family members, visited, and healthcare workers from the spread of infection. Mainly when you do the isolation, the disease can be prevented from one patient to another patient, or from the patient to the family members, or patient to the healthcare professional or visitor. So proper parry technique can be used to preventing the infection when you do the isolation of the patient. So types of precautions, mainly when the patient, they are isolated condition, certain the isolated recommended precaution we use, like airborne precautions can be used, and droplet precaution, contact precaution, and standard precautions. So disease specific isolation, what are the diseases which specifically should be isolated, and which are the diseases can be used for the precaution measures. Mainly standard precautions which are used for certain disease condition, mainly cytomegaloviral infection, HIV infection, then hepatitis B and C infection, then aspergillosis. So these are the infections which come as a standard precaution. So here the standard precautions instrument, the equipments can be used to prevent the infection transmission from one person, from the patient to the other healthcare personnel or the caregivers. So contact precautions, mainly the contact precautions which can be transmitted through the contact, like MRSA, it's called methicillin resistant staphylococcal RES, which can be transmitted from the one person to another person through the contact. Again, VRE is called VRE, which is called vancomycin resistant enterococcus and adenovirus. Diarrhea. So diarrhea. So diarrhea, again, Clostridium difficile, rotavirus, then E. coli, enterovirus, Salmonella, Shigella, hepatitis A, and herpes zoster, and herpes simplex. Again, RS for respiratory syncytic infection, lice, scabies, chickenpox. So these all the diseases for the contact precaution, where through the contact this infection can spread from the one person to the another person. Droplet precaution, mainly through the droplets certain infections can spread. So these patients also should be isolated, mainly pertussis, influenza A and B, then MRSA. I told the methicillin resistant staphylococcus aureus, Neisseria meningitis, and Coxsackie viral infection, bacterial meningitis, then RSV, it's called respiratory syncytic virus, mumps and rubella. So these all the droplet infection also patients should be isolated. Then the airborne precautions, mainly the airborne disease which can be transmitted, these patients should be isolated, mainly chickenpox and disseminator herpes zoster virus and measles. So these patients like tuberculosis, SARS and avian influenza. These all the patients should be isolated as per recommendation, and they need to use certain standard precautions or like contact precaution, droplet precautions. So airborne precautions, a causative agents of disease under the airborne precaution less than 5 micrometer, those can carried out away from the air current. So it can be spread through the air when the organism is less than 5 micrograms. So what all the airborne precaution can be used when the patient, they got the airborne infections? We discussed many airborne isolation condition. Mainly the patient should be used, the healthcare professional or the caregivers, they need to do the proper hand washing. So hand washing is the main measure which can be used when you handle the patient or the caregiver. Then the proper well-fitted mask. So mask is because this infection can be transmitted through the airborne. So the healthcare professional as well as the caregivers, they should use for the proper well-fitted N95 mask or surgical mask. Again, the door or the room should be closed properly, because the infectious organism can spread to the one person to another person. So the door of the room should be remain closed. So the main the airborne precaution can be followed the patient with airborne disease. So contact precautions, mainly through the patient contact when we are going to get the disease condition, what all the precautions can be used? Mainly the contact precaution as a healthcare professional, we can use for the gloving technique, and the we can be used, because through the contact which can be spread whenever we touch the patients. So we can use for the gown, glove, and mask. So droplet precautions, or the disease which is spreading through the droplets, which can be prevented by using the droplet precautions, like performing the proper hand washing, like the visitors or the staff members. Again, the patients also can do the hand washing and proper wearing of the mask. So whenever because the droplet infection can be spread through the patient, so patient also can wear the mask as well as healthcare professional. Then proper gowning technique and the proper capping and the eye shield. With if there is a face shield can be wear, again eye lobe can be used. So these are the droplet precaution can be used. So standard precautions. So standard precautions, certain diseases can be prevented by using standard precautions, certain bloodborne diseases like performing the proper hand hygienic procedure and using proper personal protective equipments. Mainly PPE can be used like gloves, gowns, masks, and eye protection and face shields. So these all the standard precaution can be used certain bloodborne diseases. So next topic, we are going to deal about the personal protective equipments or devices, because the personal protective equipments which can be used by the healthcare professional in order to protect themselves as well as to prevent the disease spreading from the one patient to the another patient. So definition of PPE, personal protective devices. PPE as defined by Occupational Safety and Health Administration, specialized clothing or equipment worn by an employee for protection against infectious materials. So which is the equipments or the clothing which will be worn by the healthcare professional or employee in order to protect the infections, spreading of the infection or prevention of the infection. So PPE examples, the personal protective equipments examples are like gloves, face mask, aprons, gown, eyewear, boots, shoe cover, caps, or air cover, eye protection, wherever is required. So this is all the personal protective equipments which can be used depending on the patient condition or depending on the precaution. As like we discussed, airborne precaution, standard precaution, based on that they can use for the PPE devices. So indication for use of personal protective equipments. So what are the indications? Mainly healthcare workers who provide the direct care to the patient and who work in the situation where they may have contact. So as healthcare professional or they have contact with the patient, contact with the blood and body fluids, excretion and secretion, because many diseases which can be transmitted by the blood, body fluids and excretion like hepatitis B, C, or certain body fluids also which can be transmitted like HIV. So the healthcare professional, those who are going to have the contact with the blood, they need to wear for the PPE. Then supporting staff, mainly supporting staff like the patient, the shifting the other workers, including the medical aided, cleaners, laundry staff in the situation where they may contact with the blood, body fluids, secretion, excretion, because other supporting staff also they are going to contact with the blood product. So they also need to wear for the PPE when they are contact with the blood and other body fluids. Then laboratory staff who handle with the patient specimen, because lab staff, the lab technician who is going to do the investigation, even they are going to contact with the patient. So they need to wear the PPE in order to prevent the occurring the infections. Then waste handler, because the biomedical waste handler, because the biomedical waste which consists of more microorganism, the contaminated organism, which can be the waste handlers also, they need to use the PPE to prevent the getting of infections. So family members who provide the care to the patients and are in the situation where they have the contact with the blood, body fluids, secretion, excretion. So family members also, those who have the contact with the patient body and the body fluids, they need to wear for the PPE kits. So these are the indications. So what are the principles as healthcare professional we need to follow when we use for the personal protective equipments? So PPE should be chosen according to the risk of exposure, as like because the airborne precautions or the airborne disease or the droplet infection or standard precaution. Based on that, they can select for any personal protective devices. So healthcare workers should be assessed whether they are at risk to exposure to the blood. So whether they are at risk to develop as a blood exposure or blood body fluids, any excretion or secretions, and choose of their items. So according to that, they can select for the personal protective device according to the risk. The second principles, avoid any contact between the contaminator. So they're going to have the contact with the contaminator used to by PPE surface. They should not have the contact with the contaminated PPE surface area like clothing or the people outside the surface area. So the people, those who wear for the PPE, they should not touch outer surface when they're going to remove. Again, discard the PPE in appropriate disposable bag and disposable office according to the biomedical waste management rule in 2016. So once the patient, they're going to remove the personal protective devices, mainly when they're going to handle the communicable disease patient, it should be discarded properly based on the hospital policies in depending on the biomedical waste bin. So do not share personal protective equipment. So the PPE should not be shared. For example, the healthcare professional, they are used the PPE, it should not be shared with the other healthcare professional. So they're going to transmit the infection to from the patient to the healthcare personnel. So changing of PPE completely and truly and hand washing should be each time on the leaves of patients. So whenever you are going to completely remove the PPE, so after removing the PPE, completely the healthcare professional, they have to do for the hand washing when they're going to do handling for the other patients also. Once we use the PPE, we should not touch with the other person. So these are the certain basic principles will be used when we use for the personal protective equipments. So the first personal protective equipment, use of gloves. So how to wear the gloves and what are the purpose of wearing the gloves? So gloves are most common type of personal protective equipment. It is used in the healthcare setting. So mainly when we do the any aseptic procedures as healthcare professional, we do use the gloves. So what are the uses of the gloves? The uses of the gloves reduce the risk of contaminating healthcare worker hands with blood and body fluids. So if the patient, when we are going to withdraw any blood sample or any sample collections, to preventing the contamination as a healthcare profession, we should not get contaminated. So we can wear for the gloves. Reduce the risk of germs disseminated to the environment and transmission from the healthcare worker to the patient and vice versa. So when we use the gloves, so when we're going to withdraw the blood, again the gloves will be discarded. So we are not going to disseminate, we are not going to spread to the disease. As well as once healthcare professional, they use gloves, which can be helping to prevent the transmitting of infection from one patient to the another patient or from the patient to the healthcare professional. So steps followed for the wearing the gloves. Step 1, the glove should be selected based on the appropriate size. So pick up one glove with thumb and 4 fingers. So we have to pick up the glove with the thumb with the 4 fingers. Then pull the glove on the hands. So we have to pull the gloves on the hands. Third step, slip partially gloved hand. So slip partially the gloved hand under the cuff of the second glove. So under the cuff of the second hand we have to put. Then pull the second glove over other hand and pull the glove up to the gown. So up to the gown and the wrist we have to wear the glove. Step 5, slip the fingers of completely gloved hand and other cuff of the first hand fully glove to gown. So up to the gloved hand we have to pull it up. Then the gloves, after wearing both the gloves, we have to adjust for the gloves completely. So these are the 6 steps followed for the wearing the gloves. The next personal protective device is the use of gowns. Is mainly healthcare professional will be using for the gowns or aprons. So gowns made up of improvised material or work to protect the wear of clothing uniform from the possible contamination with microorganism and exposure to the blood and blood fluids, body fluids, secretions and excretion. Mainly the gowns will be used to protect the healthcare professional from the exposure to the blood and body fluids and secretions. Even the gowns is used only once one patient. So when we use the gowns only once, we have to use one patient and should be discarded, mainly disposable gowns when you use. So wearing of the gown, the steps are wash the hands. So before wearing the gowns, the healthcare professional, they need to wash the hands and dry properly the hands. Hold the gown at the neck on the inside, permitting to the uphold. So we have to hold the gown neck and inside and permitting unfold. On the slide hands and arms down the sleeves. Then fourth step, fasten the ties at the neck. Then overlap the gown at the back as much as possible and secure the waistband. The requires assistant to fasten the waist ties. So the picture will show the steps in detail. As like I told, dry the hands properly. After the drying the hands, we have to pick up the apron. After picking the apron, let the gown should be unfolded. We have to unfold the gown, folded gown, and open the locate the sleeves. So we have to locate and arm should be inserted. Then fifth step, slip the arms into the sleeves and hold it the arms out hand slightly up. Then circulate nurse or assistant should be tying the gown. So next, personal protective equipment is the use of aprons. So aprons in Indian healthcare scenario, aprons are used in the general attire for the healthcare workers, especially for the doctors, mainly healthcare professional, even the doctors and the nurses, they'll be using for the apron. Aprons are used PPE to protect the wearer as a uniform from the contact with the contaminated body fluids. Mainly it is used to avoid as a uniform, or it's to avoid the contaminated the body fluids. When the plastic aprons when we use, it should be discarded if this have the contact with the blood and body fluids. So next, personal protective devices is a use of caps. So caps are used when splashes of the blood and body fluids is expected. So sometimes the blood or the body fluids will be expelled. So that particular time as a healthcare professional, they need to wear for the caps. So wearing of the caps should protect the hair from the aerosol that may otherwise log on the air and be transferred to the parts of the healthcare workers, such as the face or the clothing or the hands or into the inmate objectives. So it can be placed in the inmate objectives. It may cause certain infections. So for that, they need to wear for the properly the cap. So the cap wearing, just you have to open the cap and you have to put it inside, and the placement should be checked appropriately. Then when we are removing the caps, remove the holding inside. So we have to hold it inside the cap, lifting it to the straight of the head and folding inside to the hood, and cap should be discarded. This is about the removal of the cap. So wearing of the mask. So how the healthcare professional we are going to wear for the surgical mask. So your surgical mask mainly which we use to prevent the infections, mainly droplet infection or the airborne disease infection can be prevented as healthcare professional when we wear. Your surgical mask protect the healthcare provider from inhaling respiratory pathogens transmitted by the droplet route. So mainly which can be used to prevent the droplet infection. The second one, it prevents the spread of infectious disease, mainly which will prevent the infectious disease such as a varicella, chickenpox, meningococcal infection, again other infections, mainly even the COVID also, which can be prevented spreading of disease from the patient to the family members, again other healthcare professionals. So when we wear the mask, what are the things we have to keep it in the mind? Choose appropriate mask size. So depending on the mask size for the adult or the pediatrician, or depending on the size can be selected. Before wearing the mask, we perform the hand hygiene before putting on the mask. So hand hygiene should be performed. The mask should be fit singly over the face. So when you put the mask, it should be fit properly, covering the nose, mouth, and the chin. So this all the area should be completely covered the mask. Then only the droplet infection will not spread from from the patient to the healthcare professional or healthcare professional to the patient. So steps should be followed for the wearing the mask. The colored side of the mask should be faced outwards. So the colored side of the mask should be covered outside with the metal strip. So in the mask, we have the metal strip will be there present in the upper part. It should be uppermost. It should be uppermost of the mask. Without the metal strip, it should be downwards. So outer color should be outside of the mask, and the metal strip should be uppermost. For the mask without color side, the side, if the mask there is no color, then the side with folding should be downwards. The folding should be downward, and the metal strip should be uppermost of the nose. So for the tie on the surgical mask, secure upper tie at the crown of the head. So secure the mask. When you are going to tie the mask, you should be secure upper tie at the crown of the head, then secure the lower tie at the nape. So at the downward of the neck, we have to tie up. So it should be proper position, should be tied up. For the earlobes type, position the elastic band around both the ears. So position the plastic is a earlobe, it's a plastic elastic one. So earlobes type. So position the elastic band around both the ears. Mold the metal strip over the nose bridge so that the mask fit properly over the face. So after putting the mask or after wearing the mask, it should be checked properly for the proper placement of the position. Extend the mask fully covered. So when we are going to wear the mask, it should be completely covered to the mouth, nose, and the chin. So we have to completely adjust the mask for the proper fitting. Then avoid touching the mask. After wearing the mask, we should not touch because it may cause infection. So avoid touching the mask after wearing. Otherwise, you perform the hand washing before touching the mask. So when you take off the tie-up mask and the surgical mask, unfasten tie. So first we have to unfasten the tie, the nape of the first, then unfasten the tie at the crown of the head next one. So we have to remove the knots. So if it is a earlobe type of mask, both the earlobes, they're taken gently from the face while touching the outer surface of the mask. We should not touch the outer surface of the mask during the taking out of the mask. It may covered with the germs and the microorganisms. So we should not touch the outer surface. And after removing the mask from the gentle, it should be discarded by the based on the biomedical waste department. So use of the goggles or the IBS. So it can be used in certain situations where the patient blood splashes or the spray which is going to happen. So the protective IBS or the goggles should be worn at all the time during the patient contact with when there is a possibility that the patient body fluids may splash. The body fluids or the blood is going to splash or it's going to spray to the caregivers or healthcare professional, then they need to wear this particular goggles. During the throat procedure, mainly endotracheal, like the tracheostomy procedure or endotracheal intubation or removal of the indwelling catheters, mainly when we are going to remove for the urinary catheters, because the splashes or spray can happen for the removal of the catheters. So the amount of exposure can be reduced through the use of protective IBS. So when we are going to use this protective devices, we can able to avoid the minimal exposure to the splashes or the spray. The full face shield may be used by using the protect the eyes and mouth and healthcare workers in the such high-risk situations. So mainly high-risk situations they can able to use to protect this particular devices. So adequate protection, although the caregivers also may wear these goggles with extra protection if it's added. For example, certain situations, for example, in COVID situation also, face shields can be worn by the caregivers also, because it also will be preventing for the infections. So this is about the topics today. We discussed about the personal protective devices and hygienic isolation and transmission-based precautions. So these are the main key elements. As like I told, the hand washing is a very essential and a simple measure which can be used by the healthcare professional, which we perform properly, which we can try to avoid for the many hospital-based acute infection to the in-hospital setting. So do you have any doubt? You can raise the hands. You can ask.
Thank you, sir, for
I think there's a connectivity issue in Amity. So I'll just see if Nima and Mr. Bhaskar can come on.
Thank you, sir. Dr. Venkatasan sir has given a detailed information regarding standard precautions that we are using in our clinical setting. Am I audible, ma'am?
Yes, you are, Nima. You're audible. There's a bit of a delay, but it's okay. Carry on, please.
Okay, sir. Thank you for your informative sections related to standard precautions. We hope all our delegants will be useful by your energetic and detailed informations how we can prevent the infections by using these all measures of standard precautions, and this can be implemented in our clinical setting, and the knowledge is very much shareable for our students also.
Nima, we can't hear you. Can you unmute yourself, please?
Yes, ma'am. Is it audible, ma'am?
Yes, now, please go ahead.
Thank you for your thank you, sir, for your valuable section of this webinar. I am now handing this section to Divya. She will proceed for introducing our next speaker.
Thank you, ma'am. Thank you.
Good afternoon to one and all. I hope you are getting the knowledgeable session through the webinar. I am Divya Pandey, nursing tutor, Indira Gandhi School and College of Nursing. You can watch this webinar and you can follow through our YouTube channel, that is rgcsk.edu. Is streaming live today webinar. It's my privilege and pleasure to welcome our fourth speaker of today's webinar, Dr. Hemamalini ma'am, on today's webinar on infection control in clinical setting, a quality role. Madam have so many accomplishments in our nursing field, and Madam have around 21 years of teaching experience in the field of undergraduate and postgraduate nursing program. Madam completed her bachelor in nursing from SRM College of Nursing in year 2000. Madam also owns master degree in community health nursing from Omel Achi College of Nursing, Chennai, under Dr. MGR University, University, year 2005. Madam also did doctorate PhD in year 2014 from SRM University. Madam have some additional qualifications like MSc in Psychology in year 2003 from Madras University and Diploma in Family Welfare Counseling from Center for Counseling, Chennai in year 2011. Madam presently working as a principal at Hindu Mission College of Nursing, Chennai. Madam is very active member and passionate for our field of nursing, as well as active member of Indian Nursing Council. Madam have organized many community programs, health camps and outreach program. Madam had participated and being the resource person in many national and international conferences. Madam have many papers published in the state, national and international journals. Madam received many awards like Bharat Vidya Ceremony Award from Indian Solidarity Council, honored with the National Mahila Ratan Gold Medal, received first prize in Power of Thought, English Education, received gold medal for the paper presentation, received Lifetime Achievement Doctorate Award, received Best Oral Paper Award, received Best Class Coordinator Awards. Madam also being an editorial member in the national and international journals. In today's webinar, Madam will deal with the topic Biomedical Waste Management for COVID-19. Madam is very energetic, passionate for our nursing field. I proudly welcome you, ma'am, to take your session and share your knowledge on the topic with all of us. Welcome, ma'am. Ma'am, slide is visible.
No, it is on sharing. Am I audible?
Yes, ma'am, you are audible.
Yeah.
Madam, you are sharing or you are sharing?
Madam, you are sharing your screen.
Shall I try?
Yes, ma'am, once you try.
Only the host can share this meeting over there.
Okay.
Wait, I'll just make you a co-host now.
Yeah. Okay, I will try. What happened? You couldn't share? Yeah. Wait a minute. Yeah, 1 minute.
It's not mine. Right.
Yeah, is it visible?
Yes, sir.
Yes, ma'am.
My screen is visible to you all?
Yes, ma'am.
Yeah, okay, then no problem. Okay, a warm good afternoon to one and all gathered here in this virtual forum. And my sincere thanks and congratulations to Indira Gandhi College of Nursing School and College of Nursing, Chairman, Management and Principal of Indira Gandhi School and College of Nursing for giving me this opportunity. And my kudos to the management and the principal for organizing this webinar during this pandemic situation, which will be a great benefit for the students. Okay, so the topic which is allotted to me is biomedical waste management during COVID. Am I audible?
Yes, ma'am, you are audible.
Yeah. Biomedical waste management during COVID. So of course, everybody know what is biomedical waste management, but we are all now in the pandemic situation. The generation of healthcare waste, the biomedical waste is huge, and we need to manage it, and proper precautions need to be taken so that infection can be absolutely prevented. So it is a very great challenge during this pandemic, that is managing the biomedical waste. So we'll move on to the presentation, the synopsis of today's presentation. The next 20 to 30 minutes we are going to see in a nutshell is the introduction about the biomedical or healthcare waste management, the definition, the objectives, of sources of healthcare waste, classification of healthcare waste, steps for waste management, and waste management guidelines. I'm going to emphasize much on the COVID guidelines during this pandemic, how to manage the waste, and then the conclusion. So the healthcare waste management or biomedical waste management. So what is, why it is very important? According to WHO, healthcare waste or biomedical waste is defined as a total waste stream from a healthcare facility that includes both potential risk waste and non-risk material. So we, the nurses, personally play a critical role in healthcare waste segregation in the hospital, because we are playing a vital role. The healthcare workers, we are playing the foremost vital role in segregation of the healthcare waste. So our knowledge, attitude, and practice regarding healthcare waste management are vital for the prevention of healthcare waste related hazards. So what is the meaning of healthcare waste management or biomedical waste management? So it is any waste which is generated during diagnosis, treatment, or immunization of human beings or animals in hospitals, clinics, or research activities pertaining to production or testing of biologicals, and we are managing the waste. So this is called as the healthcare waste and healthcare waste management. So what are the objectives? Why we need to manage? Why we need to treat the waste which is generated?
Yes. Ma'am, just a second. We can't see you, so we're trying to share from our end. I'm sorry to interrupt like this. Because we only saw your photograph. We want to see you also. So just give us 30 seconds.
Okay.
If you want, you can carry on talking, ma'am. We'll just put the slides on.
I couldn't see my slides, no? Yeah. So you are sharing.
One minute, Yama.
Okay.
From that, you can see the slide also. From there, you can present. For our YouTube, your picture also will come and your slide also. For that purpose.
Okay.
Thank you.
So I think all are hungry now. So how many participants are there totally?
We have about 247 right now.
Okay, right now. Okay, good. So when I entered at that time, I think more than 340 participants were there. Now it has been, they left her.
For your presentation, everyone will come back. You can.
No, because it's unlucky, when we do the last presentation, definitely people will get tired and they will move on. That is the drawback for the last presenter.
Our media presentation more, even Zoom as well as YouTube. There is a 3 lakh plus. So it is almost you are covering entire year also, that rgcsk.edu.
I have seen.
Yes, so many videos for us.
Are you being able to do it, Mr. Bhaskar? Otherwise, we'll tell ma'am to present and
Yes,
carry on.
I tried, ma'am. I can do it from my side. Yes, ma'am.
Sorry to all the attendees. Just give us 2 seconds to figure this out.
Yeah.
Now you're able to see the slides, ma'am?
Yeah, slides started screen sharing. It's coming. Scrolling. I couldn't see the slides.
What about others, ma'am? You can see, ma'am?
No, I can't see either. I can only see that you're trying to share.
What problem? Usually the people can share the screen. Or shall I do?
1 minute, I'll try it once again.
Usually it will come.
Yes, ma'am. 1 minute. Any slides, ma'am?
No, I think we'll just let ma'am present it. I think we won't hold anybody. I'm sorry, ma'am, will you please present from your end?
Again, I need to share, no?
No, 1 minute, 1 minute, I'll come this, sir. Which one will go? Stop sharing. Stop sharing. Share.
No, shall I share or not?
Wait. Doctor, this one. This. Not coming. The sharing is possible.
Either resume share, why it is coming?
Better you can share, ma'am.
Okay. I can. This will stop other screen sharing. Yeah, you can stop screen sharing. Then only I can able to continue. Okay. Yes.
Disabled. Yeah, you can.
No, you didn't stop. Okay, I got it. So shall I continue?
Yes, please, ma'am.
Yeah. So what are the objectives of healthcare waste management is to minimize the production and generation of infectious waste. As I told previously, so huge production of waste will be there. So we need to minimize the production by various modes and then recycle the waste after to the extent possible. So maximum to the extent, so whatever we are collecting from the various channels, it has to be recycled and then we can able to treat it. And treat the waste by acceptable methods like various methods are there, incineration, and then many methods are there, we can treat it. And then adequate care in handling waste to prevent infections. While transporting the waste from one end to the other end, there should be adequate care. So there should not be any transmission of infection, those who are handling the waste. So that care should be taken by wearing proper PPE and other taking precautionary measures. And safety precautions during handling biomedical waste, of course, which is very, very important. So when we are handling, starting from the healthcare workers to the class 4 workers, those who are handling the waste, they should take appropriate safety precautions. And what are the sources of healthcare waste? So where we get all these biomedical waste from the private hospitals, from the government hospitals, and from the nursing homes, not from only big corporate hospitals, right from the corporate hospitals to the smallest clinic and to the sub-centers, we'll be getting lot of healthcare waste. And nursing homes, physical clinics, offices, dental clinics, dispensaries, medical research and training institutions, mortuaries, blood bank and collection centers, and vaccine center. And what are the classification of healthcare waste? There are various classification of healthcare waste, we can say. So here, which is very hazardous, the healthcare waste. So the chemical waste like lab reagents and disinfectant solvents, and then pathological waste like body parts, and then blood and other fluids, and pressurized containers like gas cylinders from the waste from that, cartridges and other aerosol things, and then infectious waste like lab culture, waste from isolation wards, etc., tissues, and then pharmaceutical waste, expired medicines, and then waste with high heavy and control batteries, and then broken thermometers, and then blood pressure gauges. So all these are the waste which is generated from the places, and then genotoxic waste like cytotoxic drugs, and then various chemicals and sharps like needles, injuries, and then other scalpels, etc. So these are all the risky waste which is very, very dangerous, which should be handled very carefully. And then these are the composition of healthcare waste, which is given in the graph. The majority of the waste is during the giving care to the clients or the patients in the hospitals or anywhere. And then that is 80% of the waste, and 14% of the waste is from the pathological and the very infectious, and 2% from the sharp waste, and 3% is from chemical and pharmacological waste, and the special waste, which comprises of 1%. And hospital waste health hazards. So what are the hazards of hospital waste? If you see proliferation of rodents, and if it is not disposed within 24 to 48 hours, then there will be a proliferation of rodents, which will be a greater nuisance to the place where the patients are getting admitted, and breeding of flies and insects, transmission of infections, air pollution, water pollution, all pollutions, and then bad odor will be there if it is not disposed quickly. And steps for waste management, if you see, there are major 4 steps for waste management. So first one is the segregation. So for that only we are having almost 99.99% of the healthcare organizations, they are using the color-coded bins and the bags. So that is by this color-coded bins and bags only we are segregating the different waste. Segregation, collection and storage, and we need to store in the appropriate bags, and then transportation. From the source generation to the disposal site, it has to be transported and then treated, and finally it is not as soon as whatever we are getting, it will be disposed immediately. The waste will be treated to the minimum risk, and then only it has to be disposed. So if you see the segregation and collection, this is how in most of the hospitals they will be collecting the waste. Of course, this everyone knows this is the biomedical rules. This is a standard precaution which is given in 2016. So this is the segregation of hospital biomedical waste. Here there are various color-coded bins are available, like green or black, and then red. So like infected plastics and infected waste in yellow, and then glass waste, infected glass waste in yellow, in blue, and then white. That is the needles and the cut glasses in the white. So in this way, the segregation and the waste will be collected, and finally it will be disposed to the common biomedical waste treatment facility. So there only it will be discarded. First, it has to be segregated properly. One, segregation should be done in the source itself. So it is very important. Many people will not segregate in the source itself. It is very important that all the healthcare workers will need to be trained in that aspect, right from the doctors to the class 4 workers. They know the color-coded bins, which waste to be discarded in the which color-coded bins. And then transportation and storage of hospital waste. The waste may be temporarily stored at the central storage area of the hospital. So there will be in every hospital, there will be a temporary storage area. Whatever is collected in the each wards, they will be collecting, and they will be storing it in the temporary storage area in the hospital. And from there, it may be sent in bulk to the site of the final disposal once or twice a day, depending upon the quantum of waste. How much waste they are generating, based on that, either twice a day or once in a day, they will be disposing from the hospital to the final disposal site. And here during transportation, the following points need to be taken care of. Ensure the waste bag or the containers are properly sealed and labeled. So this is where people will do mistakes. So it will not be sealed properly and it will not be labeled properly, whether it is a infectious waste or non-infectious waste or it is a food waste. So we need to be labeled properly so that the handlers will be aware that what type of waste they are carrying, so that they will be transmitting the waste, disposing the waste in a precautionary method. And bags should not be filled completely. So people should not fill the bags all with the waste completely, so that we cannot hold the neck of the bag if it is filled completely. So when we hold the neck of the bag only, we can able to transport in a very safe manner. And at a time, one bag should be lifted. It is not that we can lift 2 bags or 3 bags, so that there will be a spillage or there will be a, sometimes there will be a leak also will be there. And transportation, which is storage, the other methods we can say is manual handling of waste bags should be minimized to reduce the risk of needle prick injury and infection. We don't know. So that's why we are telling that we need to label it, whether it is a sharp waste or whether it is a infectious waste. So manual handling should be avoided. As far as possible, we can use some some vehicles or medium of vehicle we can use. And biomedical waste should be kept only in a specified storage area where it is mentioned. It should not be kept as it is wherever they can store it. So there should be a waste generated area. So there only people should store the biomedical waste. No untreated biomedical waste shall be kept stored beyond a period of 48 hours, as I told. So 24 to 48 hours is the time period. So before that, it should be disposed. Otherwise, there will be a all sort of pollution will be there, and there will be a lot of nuisance in the hospital. And what are the 5 ways of treating the medical waste? I told before disposing, the waste need to be treated to reduce it to a minimum risk to the public. So incineration method and the non-incineration system. Incineration is the first method. So we can burn it, and then the other ways like thermal, autoclaving, and then irradiative like microwave, chemicals, and then biological method by using enzymes that is under process. So these are the 5 ways we can use depending upon the waste material. It can be used which system of treating the medical waste. So incineration and non-incineration system, thermal, irradiative, chemical, and biological. So these are the 5 ways of treating medical waste. Once it is collected, and then only it should be disposed. So far we have discussed about the common method of biomedical waste handling and how to transport and how to dispose it. Now the Central Pollution Control Board have given a guidelines during this pandemic situation, because many people are getting affected. So we need to handle the waste in a very precautionary method. So for that, Central Pollution Control Board have given a guideline. So we are going to see that guidelines now, so that we can able to prevent people from infections. So what are the guidelines for handling, treatment, and disposal of waste generated during treatment, diagnosis, quarantine of COVID-19 patients? So if you see COVID-19 isolation ward, almost all hospitals have been now COVID hospitals. So if the hospital is having 500 bedded, almost now 400 bed has been allotted to COVID-19, because the incidence is that much during this pandemic situation. So all the wards is considered as the isolation, COVID isolation ward. So we know that isolation wards are those where COVID-19 positive patients are being kept for treatment or diagnosis. So what we need to do, what are the guidelines we need to follow in those isolation wards? If you see, keep separate color-coded bins with foot operated lids. That's very safe. It's not that we need to touch, we need to open and then we have to discard it. So it should be with the foot operated lids, bags or containers in the wards, and maintain proper segregation of waste, as we have seen the different color coded bins. Same only we are going to use it, but with a very double precautionary method we need to follow. As per the Biomedical Waste Management Rules 2016 as amended, and this Central Pollution Control Board guidelines for implementation of biomedical waste management rules. So I said, as precaution, double layered bags. It's not single bag. Using 2 bags should be used for collection of waste from COVID-19 isolation wards, so as to ensure adequate strength and no leaks. There should not be any leak so that you can able to carry the bag or the bins. In order to deal with COVID-19 pandemic, so state and central governments have initiated various steps which include setting up of quarantine centers. Of course, we know many of the colleges and many of the institutions have been converted into quarantine centers and COVID centers. So to meet the demands of the people during this pandemic. So setting up of quarantine centers, camps, isolation wards, sample collection centers and laboratories. So these specific guidelines for management of waste generated during diagnostics and treatment of COVID-19 suspected or confirmed patients, they are required to be followed by all the stakeholders, which includes the isolation wards, quarantine centers, wherever it has been collected, they have to follow the specific guidelines which has been formed. So quarantine centers, sample collection centers, laboratories, urban local bodies, that is from the house to the, because in home quarantine, in nowadays many people are in home quarantine because they are also producing the waste which should not be contaminated with the general waste. Okay, so they have to separately give the waste to the urban local bodies and common biomedical waste treatment and disposal facilities in addition to the existing practices under BMU W Management Rules 2016. And collect and store biomedical waste separately prior to handling over the same common, what is CBWTF is common biomedical waste treatment facility. So it is, there is a common place where all the waste will be collected and it will be treated. So use a dedicated collection bin labeled as COVID-19. So it is not that only we need to, previously we used to label as it is a infected, it is a non-infected, it is like that we'll be labeling. Along with that, added to that, now we need to do. Yes?
I'm sorry to disturb. There will be a message for you to receive a video. So accept that message.
I need to accept, huh?
Yes, ma'am.
Okay, I need to go again. Okay.
Any message?
Any message came, ma'am?
No, because I'm sharing the screen. No, I didn't get any message.
No.
Shall I continue?
Now we'll check video, start video.
Ma'am, any message is there?
No, I didn't get. I need to go to the wait, I will see.
Dr. Hemamalini, if you can stop sharing, Mr. Bhaskar is sharing now.
Start my
Please
video.
Start. Now yeah, that's fine. Thank you very much.
Okay. Now it's okay. Okay. It's okay. I'm audible now.
Yes, ma'am. Ma'am, please continue.
Yeah, okay. So in order to deal with COVID-19, so this we have seen. So all the wards and the urban local bodies, they need to follow the guidelines which has been formed. So you are sharing. I cannot move my slide. Next slide, can you share?
Okay, ma'am.
Yeah. Can you share my next slide? Yeah, yes, thank you. So the wet and the dry solid waste bags to be tied securely, because this is the bag where there will be a lot of leak. So that should be securely in the leak-proof bags, sprayed with sodium hypochlorite solution and hand over to the authorized waste collector or urban local bodies on a daily basis. So this yellow colored bag should not be used for collecting the general solid waste. So the compostable bags should be used for collecting the wet waste, mainly to prevent the leakages. And maintain separate records of waste generated from COVID-19 isolation wards. So how much waste we are collecting. So we need to maintain a separate records daily. Use dedicated trolleys and collection bins in COVID-19 isolation wards. Label COVID-19 waste to be pasted on these items also, because people can able to identify this is the waste generated from the COVID-19 wards. So it's a non-COVID waste or COVID waste, so that people can be handling the waste in a very gentle manner. Next slide. Yeah, the inner and outer surface of the container bins trolleys used for storage of COVID-19 waste should be disinfected with 1% sodium hypochlorite solution daily. It needs to be both inner and surface. It is not that daily we can use the same bins. It needs to be disinfected with 1% hypochlorite solution daily. And then the report opening or operation of COVID-19 ward and COVID-19 ICU ward to be state pollution control. Every day report needs to be sent. So here state, what is SPCB is State Pollution Control Board and Pollution Control Committees. So now it has been formed during this pandemic situation, and the respective common biomedical waste treatment facility located in that area. So particular area we need to report the waste generated and then register in Central Pollution Control Board mobile application, namely COVID-19 BWM to update the details of COVID-19 biomedical waste generation. So it's a mobile application. We need to register and we need to update the details, not only the hospitals, the waste generated in the hospitals, as well as the waste generated in the quarantine centers and the COVID centers. Yes, next slide, please. So depute dedicated sanitation workers separately for biomedical waste and general solid waste, so that waste can be collected and transferred timely to temporary waste storage area. So we need to even segregate the sanitation workers for COVID waste and non-COVID waste, so that it will be easy for them to collect and dispose it. And then here pieces from COVID-19 confirmed patient who is unable to use toilets, which is very important, and the excreta is collected in a diaper, must be treated as biomedical waste and should be placed in yellow bag container. So if the bedpan is used, then pieces be washed into the toilet and cleaned with a neutral detergent and water, disinfected with 0.5% chlorine solution, then rinsed with clean water. Then only it should be discarded or disposed after treatment with 0.5% chlorine solution. And collect used PPE such as goggles, face shields, splash proof apron, plastic coverall, hazmat suit, nitrile gloves, etc. into red bag. Yeah, next slide, please. Collect used mask, including triple layer mask, N95 mask, head cover, cap, shoot, or all the PPEs, disposable linen, gown, non-plastic or a semi-plastic cover, all in the yellow bag. Segregation of biomedical waste and general solid waste should be done at the point of generation in wards or isolation rooms. There should be no segregation of biomedical waste and solid waste, temporary at temporary waste collection of storage area of healthcare facility to ensure occupational health safety. It should be, as I told previously, it should be segregated at the point of generation, not at the storage area. It will be utter waste when you segregate at the storage area. And provide training to the waste handlers about infection prevention measures such as hand hygiene. So already the previous speaker have told about enough regarding the hand hygiene. Respiratory etiquettes we need to follow. Social distancing, use of appropriate PPE, etc. via videos and demonstration in local languages. So the government and many non-governmental organizations have taken a lot of measures in initiating and propagating regarding the COVID appropriate behavior to the public. And designated nodal officer for biomedical waste management in hospitals shall provide training to the other healthcare workers. A nodal officer should be there, and he will be giving training to the other healthcare workers regarding the management of hospital waste. Yeah, next. Next, we will move on to the responsibilities of persons operating quarantine centers, camps, home quarantine, or home care facilities. So those who are dealing with this, so their responsibilities again plays a vital role, because everybody, almost 80% of the people are in home quarantine now. So general solid waste generated from quarantine centers or camps should be collected in bags, securely tied and handed over to the municipal solid waste collector identified by local bodies for final disposal. Even when people are coming in the streets to collect the waste, so the general people will not collect waste from the people with COVID, because to collect the waste from the COVID house, so separate vehicle will be coming, because they don't want to contaminate. Even we are seeing in our streets also, they will not collect, that is, they will not combine both COVID and the non-COVID waste. Separate vehicle will come collect the waste from the people, those who are having COVID or those who are in home quarantine. So that is the thing. And only the used masks, gloves, tissues or swabs contaminated with blood or body fluids of COVID-19 patients, including used syringes, medicines, etc., any generated should be treated as biomedical waste. And biomedical waste, if any generated from quarantine centers, camps, should be collected separately in yellow bags and suitable for biomedical waste collection provided by urban local bodies. So these bags can be placed in a separate and dedicated dustbins of appropriate size. General waste should not be stored in the yellow bags. Next slide. Agency responsible for operation of quarantine center camp shall designate a nodal person who will be responsible for waste management for maintenance of its record. So the agency which is responsible for this quarantine, they have to designate a nodal person. Nodal person is very important because so they will be maintaining the daily record of the waste generated. And designated nodal person of the quarantine center camp shall register the center camp on Central Pollution Control Board's biomedical waste tracking app, COVID-19, this mobile app, which is available on the Google Play Store, and update the details of waste generated on a daily basis. And then persons operating quarantine camps centers should call the common biomedical waste treatment facility operator to collect the biomedical waste, and when it gets generated, contact the details of this common biomedical waste treatment facilities would be available with the local authorities. All the people, those who are home quarantine, they need to have contact with the common waste treatment facility so that they can able to give the waste generated to the local urban local bodies. Okay, next slide, please. Persons taking care of quarantine home or home care should deposit biomedical waste, if any, generated from suspected or confirmed COVID-19 patients in home care by following any one of the following methods as may be arranged by the urban local bodies. They can follow any one method, that is hand over the yellow bag containing biomedical waste to authorized waste collectors at the doorsteps engaged by the local bodies. So it is not that we need to go. They will be coming and they will be collecting the waste from us. And deposit biomedical waste in yellow bags at designated deposition centers established by urban local bodies. The bag again be stored in yellow bag or container. Or hand over the biomedical waste to the waste collector engaged by the common biomedical waste treatment facility operator at the doorstep. Persons operating quarantine camps, centers or quarantine homes, they need to be feel very difficulty. So at that time, they can they can collect the biomedical waste at the doorstep itself. Yeah, next slide, please. Yeah, next one is, again, this is also very important, duties of the common biomedical waste treatment. We are keep on talking about the CBWTF. This is the new term which everybody now need to know. So it is the common biomedical waste treatment facility. So what are the duties of this common waste treatment facility? Yeah, next slide. So what are the duties if you see? Yeah, next slide, please. Yeah, report to the State Pollution Control Board or Pollution Control Committee about receiving of waste from COVID-19 isolation wards, quarantine camps, quarantine homes, and COVID-19 testing centers. Operator of common biomedical waste treatment facility shall ensure regular sanitization of workers involving in handling and collection of biomedical waste. They have to go for regular sanitization of workers. We need to give all the facilities to them. And workers shall be provided with adequate PPEs. Again, many people think that only people with direct care with the patients only need to wear the PPE. It is not that. It is not like that. People, those who are handling the waste, because they are more prone to get infections, because they are handling the waste which is generated, which includes which may prone to get a lot of infections. So we need to check whether they are getting the adequate PPEs, whether the handlers are getting the adequate PPEs, including 3-layer masks, splash-proof aprons, gowns, nitrile gloves, gumboots, and safety goggles. Even when I see in our streets, usually they will be wearing only the mask and the gumboots they'll be wearing. So not other things, but they have to see the urban local bodies or the common treatment facilities. They should see to that whether the waste handlers are using these PPEs, whether they are getting these PPEs, and then use dedicated vehicle to collect COVID-19 ward waste. It is not necessary to place separate label on such vehicles. And then vehicle should be sanitized. Even the vehicle also should be, because it's carrying, it's a mode of transmission. So vehicle should be sanitized with sodium hypochlorite or any appropriate channel disinfectant. After every trip, the vehicle need to be disinfected. And COVID-19 waste should be disposed of immediately upon receipt at the facility. So at the facility, when it is getting collected, immediately it should be disposed. And in case it is required to treat dispose more quantity of biomedical waste generated from COVID-19 treatment, this treatment facility may operate their facilities for extra hours by giving information to State Pollution Control Board and Pollution Control Committee. So if at all, if the generation of waste is huge, then they need to give instructions to the waste handlers to work for extra time. And these are all the guidelines which has been put forth now to handle the crisis situation. And the operator of treatment facilities should maintain separate record for collection, treatment, and disposal of COVID-19 waste, and do not allow any workers showing symptoms of illness to work at the facility. Immediately, if they show mild symptoms, they are not allowed to handle the waste. May provide adequate leave to such workers and by protecting their salary. And then there's a common treatment facility operators shall register on COVID-19 biomedical waste management tracking app developed by the Central Pollution Control Board, and also ensure so whether data has been registered, data has been recorded in that. So we need to check that waste handlers for entering the data of COVID-19 biomedical waste received and disposed, whether they on daily basis, whether they are receiving and then they are disposing it very quickly. We need to track the app. We can able to identify the data. Yeah, next slide. And providing training to the waste handlers on infection prevention measures, hand hygiene, respiratory etiquette, social distancing, and use of PPE via videos and demonstrations. So nowadays, through WhatsApp and through various modes, even the hand washing technique, and then using of how to wear the gowns, mask, all measures. Even the lay people know how to use the, because that much awareness has been created and it has been propagated through various channels. Now the public is very well aware about how to use the PPE. And then sanitation workers more than 50 years of age should be posted for management of non-COVID waste. And again, these are all the major things which I've added, the COVID guidelines. And coming to the conclusion, unregulated biomedical waste management is a public health problem. So this has posed a grave threat to not only human health and safety, but also to the environment for the current and future generations. So safe and reliable methods for handling of biomedical waste are of paramount importance nowadays. And effective biomedical waste management is not only a legal necessity, but also it is a social responsibility. It is not that only the people, those who are working in the hospitals, those who are handling the waste only should follow the specific guidelines. Even a single individual have to have the social responsibility. Then only we can able to overcome this challenge. And biomedical waste management should ideally be a subject of the national strategy. So which we need to follow all the legislative measures and competent regulatory authority and trained personnel. So each and every person needs to be trained in that aspect and they need to follow this. Yeah, next slide. So let the waste of the sick not contaminate the lives of the healthy. So we need to segregate. So we need to understand, we need to segregate, properly transport, and then we need to dispose it before we need to treat it, and then only we have to dispose it. And thank you one and all for your patient listening. Thank you so much, Dr. Bhaskar and the management for giving this wonderful opportunity. Thank you. Thank you.
Thank you so much, ma'am, for the bundle of information. But we are very sorry for disturbance in the presentation. You covered all the portion and the biomedical waste management for COVID-19, like the definition, objectives, hazards of hospital waste, step for the management of hospital waste, transportation, storage, collection, and the 5 main ways of treating the medical waste. Guidelines for handling COVID-19 patient, collection of waste, duties of common biomedical waste management facilities. These all topic covered very nicely, and we had a very great session with you, ma'am. Knowledgeable session. Not only student, all of us had a very good session on this topic. Thank you so much, ma'am, for your knowledgeable session and previous.
We are coming to the end of the sections. Delegates, you have any questions?
All are hungry, I think so.
If you have any questions, please raise your hands. We'll take your questions one after the other. So I'm going to unmute Sanjay Yadav to ask her question. Please go ahead, ask your question, Sanjay Yadav.
Sankhya?
Student voice not coming.
Okay, we'll move to the next one. Aarti Yadav to ask a question, please.
What are the measures followed to COVID-19 in infection control?
As an
So I didn't get, what are the?
What are the measures followed to COVID-19 in infection control?
No, I didn't get you, your question.
What are the measures to control the COVID-19?
Infection, yeah, of course. COVID-19 waste, what are the major measures is properly we need to hand washing. Again, hand washing and proper handling of waste from the source to the disposal site. That is the major thing. So from the source to the disposal site, how we are maintaining our that is infection control practices, proper hand washing and then disinfection, treating the waste. So these are the measures we need to practice so that we can able to control the infection.
Any other questions?
Aditi Ojha, next question. Aditi, अपने आप को unmute करके please question पूछें. Okay, should we move to the next one? Ravi Verma, I'm unmuting him to ask the next question.
Hello.
Hello.
Good afternoon, ma'am.
Good afternoon.
Ma'am, my question, what is the hospital acquired infection?
Yeah, hospital acquired infection is nosocomial infection, which has been dealt by the second speaker in detail. Yes, have you listened to that? Hospital acquired infection is nosocomial infection when the patient is getting admitted in the hospital. The infection which is acquired during the process of treatment and other measures, the infection which is acquired is called as the hospital acquired infection. Otherwise, it is nosocomial infection. Yes.
As a health worker, we have to take a good standard precautions in order to prevent transmission of hospital acquired infection.
Yeah.
Okay, I hope you will be clear.
Okay.
Okay. Ma'am, can we move to next session, ma'am?
Yeah, next session is there. I am the last presenter, no?
What?
Okay.
Okay, I think no more questions. We'll stop the questions. You can end the session, Nima.
Okay, thank you, ma'am. Thank you. Good afternoon to one and all. I am Mrs. Nima, Professor of Indira Gandhi School and College of Nursing. It's my pleasure and great honor to purpose this vote of thanks on behalf of myself on this fourth series, Infection Control in Clinical Setting, on 10/6/2021 on this today. This is my great opportunity to thank our Almighty God. By God's blessing and grace, we are able to make this event what it was and a successful one. First and foremost, I am on behalf of myself and entire family of Indira Gandhi School and College of Nursing, a special, sincere, hearty vote of thanks for our Godfather, Administrator, wonderful opportunity to organize the webinar series in our prestigious institution, Indira Gandhi School and College of Nursing. We are blessed by you, sir. Thank you, sir. It's my gratitude and love to express hearty vote of thanks to our director, ma'am, Srimati Sharmila Roy Chaudhary, ma'am. Today we had the opportunity to hear your thoughts and definite encouragement in our future. Thank you, ma'am, for your keynote in this webinar. I am very fortunate to thank our respected chief guest of today's webinar, Dr. Dinesh Selvams, sir. We are grateful for you, sir, your excellent coverage of infection control on clinical setting and quality tool. Sir has given a good idea on this topic and we are inspired and it will be practiced in our future clinical setting. Thank you, sir. Lack of words for this participation and they are willing to complete tasks beyond their comfort zone. We have been fortunate to be supported by a team of very active who are well versed in their job. So I give a special thanks to Srimati Divya ma'am for her keen organization of webinar in rgcsk.edu for reaching this session in a mass participants over the world. Thank you, ma'am. I thank our well-wisher, Mr. Bolanath Tripathi, sir, General Manager, for giving such a guidance for organizing the webinar. Thank you, sir. A special mention to our venerable principal, Mr. Ilakwana Bhaskararaj, sir, being the catalyst that expert us and stand as a pillar of power in an organizing this webinar moving about a week ago. With deep sense of appreciation, I thank our principal, sir. I would like to take this opportunity to record my heartfelt thanks to all our eminent expert speakers in this today webinar, Professor Santhosh sir, on the concept of infection control and hospital acquired infection, Dr. B. Venkatasan sir, standard precautions. Sir has given detailed information regarding hand hygiene and personal protective equipment measures. And Dr. M. Hemamalini ma'am, Madam, energetic words on biomedical waste management. Thank you all speakers. Your thoughts have enlightened our minds and shows a new path. Thanks to all the speakers for adoring this occasion and sharing this knowledge benefitedly. I hope all our participants are benefited and this will be utilized in their future clinical setting. My lovable thanks to all delegates who participate in this webinar session and made this one successful. I hope you all got information and adhere knowledge regarding the topic on infection control in clinical setting, a quality tool, and this will be practiced in your future. Germs are small, but still very scary. Germs are not for sharing. Follow cleanliness to kill the tomorrow diseases. We are not here to change the world. Let's save because we are here. Practice infection control in health setting, a quality role. This is from our heart of Indira Gandhi School and College of Nursing for all the healthcare workers. You all can watch this webinar on rgcsk.edu, our YouTube channel. And be informed, be prepared, be smart, be safe. Be ready to fight the third wave of COVID-19. So practice all the healthy behavior of hand hygiene, frequent use of sanitizer, use the mask, have a distance, social distancing, and be in your home and safe. And we will meet you in another webinar soon. Thank you all. Thank you, ma'am. Thank you, sir.
Thank you all. I'm sorry that I'm late. I was busy trying to organize oxygen facilities for the hospital. So, but please convey my best wishes and thanks to all the participants. And also tell Dr. Hemamalini that maybe others had left. I joined when she was speaking rather than the other participants leaving. So there are people who join late sometimes. Thank you very much, Nima, and God bless you all. Thank you.
Thank you, sir. Thank you, sir.
Thank you.
Thank
Have a nice day.
Thank you, everybody. You can disable your video. I'm ending the webinar. Thank you very much. Bye-bye.
Thank you, ma'am. Bye.